Bore da croeso I gyfarfod y bwrdd. Good morning and welcome to today's Digital Health and Care Wales board meeting. As is our usual current practice, the board meeting is being held virtually, and we're broadcasting the meeting live. There will be a recording posted on our website very shortly after the meeting if people wish to view the meeting in recorded version. Simultaneous translation facilities are available. For those of you who are not familiar with how to access those, if you hover your cursor over the screen, you'll see a globe icon come up at the bottom. If you click on that and you wish to hear the translation, then just select Hear Translation. If you don't need to hear a translation, then just remain in original audio channel. As is usually the case, as indeed is the case at the moment, people might not always be looking at the screen. We apologize for that because obviously we're looking at our papers in front of us. We'll be taking a break during the meeting today, and this has been scheduled when we conclude section 5 of the agenda, and will be for approximately 30 minutes, and we'll be aiming to conclude today's meeting by 2:15. As board members will be aware, hopefully you've had an opportunity, you've looked through the consent agenda and raised any questions you have on that. I've not been notified of anything anyone wishes to bring onto the main body of the agenda. I won't invite introductions from all board members, but I do welcome extend a welcome to those people who do not normally attend the board, and Mark Cox, who's attending on behalf of Claire Osmondson Little, Dr. Jason Shannon, who's the lead medical examiner for item 3.1, and Michelle Sell will be joining us later for item 5.1. Before we start the agenda, it's a sad thing I would like to do now, and that's for us to take a few moments silence to remember one of our colleagues, Marcin Haberski, who's one of our senior solution architects who died suddenly and in very tragic circumstances last month. Marcin was a valued member of DHCW who'll be greatly missed by everyone, all his colleagues. On behalf of the board and DHCW, I'd like to extend our sincere condolences to Marcin's family and friends at what must be a very difficult time. So if we could pause for a moment as a matter of respect. Thank you. Thank you, everyone. Thank you. I'll now proceed with the agenda. The apologies for absence. We've received apologies from Andrew Fletcher, Sam Hall, and Claire Osmondson Little. I'm not aware of any other apologies. Looking at the screen, I think everyone else is here. I've had no conflicts of interest indicated by members of the board prior to the meeting. Has anything occurred to anyone since then? No. Okay, thank you very much. I'll move now to the consent agenda. As I mentioned, hopefully if you have questions, you've been able to ask those and had them answered by the relevant director. So I'll then move on to the items that we're specifically being asked to approve and note. The first one is the minutes from the board meeting held on the 30th of March. And Eve, I think you've just wanted to point something out in those minutes. You're on mute, Ivan.
Apologies. Yeah, just in item 4.1 on the integrated medium-term plan, the minutes note that the board approved the IMTP, but we also noted or we acknowledged that it was being submitted to Welsh Government as an unbalanced IMTP, and I think it'd be helpful if that was reflected in the minutes.
Yeah, absolutely. Thank you, Ivan. And Chris, if we can make sure that that's done. And then approving the private abridged minutes from the board meeting held on the 30th of March on the same day, 2023. People happy to approve those? Thank you. Approving the private abridged meeting minutes from the joint extraordinary meeting of DHCW and Cardiff and Vale Health Board private board meeting held on the 20th of April. People happy to approve those? Thank you. Approving the private abridged minutes from the extraordinary private board meeting held on the 20th of April 2023. Are people happy to approve those? Thank you. And now we've been asked to note that there are no actions on the action log outstanding, and to note the forward work plan. Are people content to note those? Thank you. If we move then to the main agenda, and the first item as ever is our shared listening and learning presentation, and I will hand over to Ridian Hurl, the Medical Director, to introduce this item. Ridian, over to you.
Thank you, Chair. It's a pleasure to welcome Dr. Jason Shannon, who's the lead medical examiner for Wales. We've been working on this, Jason, since its inception, I think this presentation will highlight some of the progress that we've been able to deliver in Wales, building on the successful accumulation of the content-rich electronic healthcare record, which is accessible and available across Wales, allowing the medical examiner service to perform its function. I hope you enjoy the presentation, and I'm sure there'll be some interesting questions for you at the end, Jason.
Great, thanks, Ridian. That's really helpful. Thank you. And Borodar, thank you very much. Good morning, everybody. And thanks for inviting me to talk to you today about the medical examiner service, a service that you may not have even heard of, or you may have heard something. And what I want to try and do today is to explain a little bit about what we do, what we're here for, but also the functionality of the service in Wales, which is somewhat different to the way in which services are being delivered in England. And I think it's one that works well for us in Wales. It's the right model for us. If I could have the next slide, please. Challenged with describing our service in one sentence, I wanted to reiterate that the medical examiner service is one that puts the bereaved at the front and centre of what it does. It gives them a voice at a very difficult time. And as I describe what we do, I think that should become apparent what benefits there are and will be for the bereaved as this service becomes more and more established. Next slide, please. So if we start with the requirements for a doctor and law to complete a death certificate under the 1953 Births and Deaths Registration Act, that's top left on your screen. That's a legal requirement for a doctor to complete. They do it handwritten. Eventually, there will be a digital MCCD across both England and Wales, which is a project that is being held at a higher level to just Wales. Of course, this law was ruthlessly exploited by Harold Shipman, who completed death certificates fraudulently on the patients he killed. And this was identified by Jane Janet Smith, who said there should be oversight over death certification and the processes associated with it by medical examiners. That was built into the law in 2009 under the Coroners and Justice Act. And there it lay dormant, waiting to be fully enacted. Since then, we've had a number of healthcare failings, most notably that of mid-staffs. And in mid-staffs, it was identified that and recognised that scrutiny of events when a person dies in a hospital setting would be of value, and that those who do that should be independent. In other words, they just assumed medical examiners would happen and they should be independent of the organisations whose deaths are being scrutinised. The response in Wales was quite swift, to be fair, and that led to the inception of the mortality review programme, which I was responsible for leading nationally from 2013. And really what this was all about was saying that every death deserves to be looked at, primarily because most deaths are not an incident. They are an opportunity to reassure a family that that is in fact the case, that they are not an incident, there was nothing untoward. But in some cases, there may be issues from which we can learn. And this was really all about learning and improvement around care. We've started with death certification, but that's where we're now focused. So we started the non-statutory rollout, both in England and Wales, in a partnership way. But it was decided right at the beginning that in Wales, we would try and do this on a once for Wales basis. So it was pretty obvious at that time, we were going to need some significant IT infrastructure and support and maximize the use of IT systems to ensure that that model would be supported. Next slide, please. Then there's another change in the law. that change meant that doctors had to, under statutory regulation, tell a coroner about a death if it met certain criteria. That was really important because that created some standardization in processes and our relationships with the coroner and the NHS. Then COVID came along and disrupted everything in the non-statutory rollout, including our appointment of new medical examiners and their start dates. So it was just me and my lead medical examiner officer during the first wave. But shared services had already been determined as the host for our service in Wales for the medical examiner service. In other words, that it wouldn't be care provider organisations that would host medical examiner services. And that, of course, meant that we would have to have a mechanism for being able to review important medical and clinical information from a host organisation perspective in shared services. The Coronavirus Act makes some changes to death certification, which I won't go through in detail, but it was all very chaotic and confusing, and we had to keep up to date at a number of points in time and keep those up to date who were doing death certificates. That all came to an end with the sunsetting of the Coronavirus Act, and then shortly the following Health and Care Act from the UK Parliament switched on, if you like, or started the engine, let's say, for the Coroners and Justice Act 2009 and the subsections bringing medical examiners into force. That primary legislation is expected to commence during autumn. And of course, because there are numerous other processes that are associated with death certification, whether it's cremation regulations, coroners, registration services, all of that now has to be dealt with through secondary legislation to be in place by April 2024. If I could have the next slide. So that is the journey. That's the journey of what we've been trying to do for a medical examiner service. I still haven't even told you yet what we do. But the way in which we've rolled out a single medical examiner service in Wales using shared services as the host is to organise ourselves into fundamentally 4 geographic hub sites that are not based in hospitals. What that means is, of course, that we need to get access to medical and clinical information. And the only way we can do that is by, from hospital sites, is to have those records digitally scanned and sent to us. But that, of course, is where the Welsh Clinical Portal for us is absolutely essential, because that gives us an immediate access to important clinical information within minutes of a person who has died, to be able to get a sense of what is going on. So the way this works is that medical records are scanned and sent when a person dies into one of our 4 hub sites, and they are uploaded into a case management system, which is hosted at the top by our Datex partners. That's a single system across the whole of Wales. Those records are then created by our medical examiner officers, who are there full time, and they will then be distributed for analysis and consideration and review by our medical examiners. And I'll come on to explain what medical examiners do in a moment. But what it does mean is that medical examiners are as far away as we can get them to be independent from the care provided. They haven't worked in the hospital, didn't care for the patient, and are not employed by the health board that is responsible for healthcare. So that makes them independent, which is really important for public perception. Our medical examiners come from a wide range of backgrounds, both primary and secondary care, and so too for our MEOs, who come from, again, a wide range of previous clinical backgrounds, whether it's nursing, paramedic, or biomedical scientist, etc., as examples. We are in a position now where most deaths are being scrutinised in the way that Dame Janet had envisaged, that are from hospital settings, and we now start the task of rolling out into community deaths, because this system will apply to all deaths that a coroner doesn't investigate. And in the fullness of time in Wales, that will be well over 30,000 deaths per year will need to be scrutinised by our service. Next slide, please. Right, so what do medical examiners do? There are 3 functions. The first is the oversight over death certification. So we need to ensure that the death certificate can be registered, it's truthful, it's factual, it's evidence-based, and it's something that tells the story of the person's last illness. The second is to make sure that everyone is compliant with the law on notification of a death to the coroner. Now that the criteria have been defined, that makes it relatively straightforward because we don't need to argue with people about what the criteria are. And then the third, and I think probably the most important one, is an opportunity to feed back further information to care providers, which really helps them with identifying where they can learn and improve from when a death happened. We ask 3 questions. We want to know what the person died from, and we give some view on what we think a death certificate might look like, bearing in mind it is the doctor that will certify. We need to cross-check those requirements to tell a coroner about the death, and we need to ask ourselves, are there any concerns that we can identify from the records, from our interaction with an attending doctor or with the bereaved. We review the clinical records. That's our first step. That's a medical examiner only function. And what they are reliant upon there are a combination, if you like, of scanned records and digitized records. And as I said, there for us, the Welsh Clinical Portal is absolutely essential, because on there, we can very quickly see whether there was a trend in, for example, hemoglobin, suggesting that somebody might have had a blood loss that might not have been picked up, or an abnormality of their salt balance that might not have been detected, and then they go into cardiac arrest. That might have been a concern. We can also, of course, review clinic letters and correspondence letters from both primary and secondary care, which gives us a framework of what the person had in terms of their illnesses during life, including, of course, cancer records. And in time, and as we are starting to roll out in primary care, a direct access mechanism into primary care records once the person has died. That, of course, will be the simplest and most straightforward manner of accessing records through an electronic agreement with GP surgeries. They can, of course, send us records, but it will be easier for them if we can do this in a passive and automated manner that is minimally disruptive to very busy GPs. We do need to have an interaction with the doctor deciding to certify, which can either be a conversation or, in straightforward cases, if they've indicated all the information that we need prior to us doing the scrutiny, then we can simply confirm that they should go and complete the death certificate. And of course, eventually that should be a digitized product across both England and Wales. Finally, we need an interaction with the bereaved, which we will do by telephone. And that's for them to have an opportunity to understand what has gone on the death certificate and to ask any questions or raise any concerns that they might have. But there are lots of things that we don't do. We don't do postmortems. We are not like medical examiners in the US. This is not a service that has an investigative role. We don't investigate death. We don't inspect hospitals. We don't provide counselling or advice on how to complete the various bits of paperwork. There are already systems in place for managing those that will remain. What we do is we scrutinise, we detect, and we pass on. Next slide, please. Okay, so the challenges for us in setting up what I would now describe as a single all Wales service based on a digital platform. So we really don't deal with paper. That means, of course, we've had to have born by paper records scanned and sent to us. We can't avoid that. But everything is done from large screens. And what that's really helped us to do is to run this peripatetic type service, where a person who might die in a hospital in South Wales, their records are made accessible to us through one of those 4 hub sites. And then a medical examiner who could be anywhere in Wales, could be in Newport, could be in North Wales, employed by us, can access those records. They could do that on a 7-day working basis. And that allows rapid and effective communication with the officers involved internally, and through DATEX system, we can produce external digitized correspondence, whether it's to coroners, whether it's back to health boards, or indeed to families if that's what they wish to have access to. The primary care access is something that's just starting. We've agreed with GPC Wales and with primary care directors in Wales a data sharing agreement that is now being rolled out across Wales, including an electronic access agreement for primary care records, and we're now trialling with a number of surgeries to see how this will work. But that team working across Wales in a remote environment is something that, although the COVID pandemic was a catastrophe for many of us, it also provided us both a necessity and an opportunity to do things very differently. There are twice daily team calls that we have in Wales where medical examiners and officers can drop in and discuss cases on an MDT basis, so that none of our staff work in isolation, even if they are working alone. The access to certifying doctors is always going to be a challenge because they're very busy, and we try and minimize that through the use of digital technology. And then, of course, access to bereaved families who at the moment may know little about the service as we roll this out on a non-statutory basis in readiness for 2024. Next slide, please. So briefly, and I think this is my last slide, what have we learnt? We've learnt actually that death certification and the law around it is not well understood by doctors. So actually one of our important functions here is to assist doctors with complying with that 1953 Births and Deaths Registration Act to complete a certificate to the best of their knowledge and belief. And that is something we're already seeing the benefits of in terms of successful registrations. Secondly, that doctors struggle to understand what coroners do, why they do it, and how they do it. So again, we are able to assist doctors in understanding the processes around coroner referral, why a coroner referral may be needed, and what the outcomes might be. Thirdly, in terms of care provision, it's been a fantastic opportunity, I think, for health boards to look at each other, to see what the variance might be between health boards in the rate of any concerns detected, because we are an all Wales standardised service. So we've taken out a lot of the white noise of the mortality review programme, and for them to focus then on issues that we have highlighted to them for their quality improvement work, and to appreciate that cases that are not returned to them, there's a high degree of assurance that there were no problems in care on the majority of cases. And that, of course, accords with what families tell us, because the commonest thing families tell us, despite everything, is that the care provision for their loved one was fantastic. And finally, with our service, what we've learnt is that you don't all have to be in an office together. An office environment is fantastic for many things, but you can add an additional layer of working remotely, agile working, underpinned by effective IT systems, providing things don't go down, and if they do, you need an effective mechanism for putting them back up again very quickly, and that we can be a once for Wales service whilst working in all corners of Wales. Next slide. Okay, diolch yn fawr iawn I chi. Happy to take any questions on what I've just gone through.
Thank you very much, Jason. Has anyone, I've got some hands going up, Helen, and then Rowan.
Thank you, Chair. Thank you, Jason. Really helpful overview of the service. And I just wondered, I've got two questions, if I may. Has the mortality review process in secondary care kind of had to change to, since the medical examiners service has come into place? And then my second question is kind of just a little bit more about the process around how you will get to know about the community deaths then, and how that will differ from kind of the secondary care process.
Thank you, Helen. Very good question. So yes, the mortality review programme has adapted. We knew that it would. I suppose for me, being on the one hand, initially the lead for mortality review across Wales, and then transitioning into this more substantive and legally based role, allowed me to see how that would happen. I think what we've done is, first of all, we've relieved health boards of having to review every death. And the reason why health boards might not want to have to review every death in their hospital is firstly because they can't do it in a standardized way if they take total ownership of it. So we've been able to say, look, we will take that on. These are the ones you need to look at. That, of course, saves them time. That means they can concentrate their resource entirely on the learning process, allowing us to carry out independent and standardized scrutiny. When health boards did that, they couldn't be independent and they couldn't be standardized across Wales. So we've actually had two benefits to the mortality review programme, one of which is around assurance on standardization and the other is on efficiency of process. Now, the only other change there is that we have decoupled a direct link between what we used to do in the first process of mortality reviewing, which then triggered automatically a second process. What we actually do is we simply carry out our scrutiny and we pass it on to the health board for them to decide how they're going to manage maybe more than one issue that we've highlighted to them, so that it becomes a bespoke thing for that person, that deceased person and their family. And in the end, I think the mortality review programme is much richer for it. You asked about primary care. So apologies, Helen, I meant to write it down and then I've forgotten the nuance of the question.
Yeah, no, will the process be different then? Because I'm assuming the data is not so available.
Yeah. So it's really important that records are proportionately scrutinized. So it's not a forensic examination. Primary care records by their nature will be much more sparse. The beauty of our service is that we've been able to employ GPs as medical examiners. And because we've been able to put them on a separate bespoke contract, we're not employing them as GPs and we're not employing consultants as consultants. We're employing all those doctors as medical examiners. That has given us an opportunity to employ lots of different people. Now we've got GPs who understand primary care and they work as medical examiners, and that's great for us because we can organise internal training for all medical examiners to understand how scrutiny will apply to a death in primary care, so that we don't have secondary care doctors thinking that they should have had an X-ray and a CT scan and a whole raft of blood tests for every single person who died. The second one is that primary care are going to have to notify us of the death. We don't have a crystal ball. So the letter that went out from Welsh Government last year to all care providers is that whilst the medical examiner service has responsibilities, having enough staff, having training, having a single system, all of the things that I've just described that are really important for us from an IT perspective, the care provider has the responsibility of informing us about the death. We can't know that the person has died. Now, one of the ways we can try and do this is to have an automatic feed from master patient and you know, to flag with us this person is no longer alive. But we need to still have that interface with primary care. We want to know that they know the person has died and that they're prepared for that interaction before we start contacting them.
Thank you, Jason. Rowan.
Thank you, Simon. Jason, thank you. That was a really illuminating presentation. And what struck me was not only are you enabled by Welsh clinical portal having all the data in one place, I think there's also a piece that perhaps wasn't touched on quite so much, which is the Welsh Accord for sharing of information, WASPI, and the fact that that framework exists, as you were describing a process where information was being shared across different organisations within the healthcare service. It would seem to be, you know, very strongly enabling of how you've been able to set the service up in Wales. Is there anything you can kind of share with us about how that has you know, made the setting up in Wales perhaps different to how it exists in England, where there isn't that that same information governance and sharing arrangement?
Yeah, I think the main word I would use, Rowan, is flexibility. It's allowed us flexibility through having a service at scale and being able to move information around within our system completely friction-free. So maybe it's best to illustrate with an example. So we may even have GP surgeries who are signed up, or a non-acute sector area that is signed up with us. They don't have to be at the moment. They don't have to do this by law. And that might be in, for example, somebody from an ethnic minority or a faith-based community where they want to have the benefits of medical examiner scrutiny but want an urgent funeral. Now, at the moment, there's nothing to stop them just sending the death certificate off for registration, but in the statutory period, that won't be possible. So what we've been able to demonstrate through a number of examples like that is that we can get that information into us very quickly. We can then, because we've got that single case management system, we can say that death needs urgent review now. There may be 40 or 50 cases on there that families are quite content is going to take a week or so, but that case, we'll put that straight to the top of the list. Who is the next available medical examiner? So that medical examiner might be now in a third place. Now they can see, okay, I'm now the next person available because I can see the time list on there and I can see that person at the top. I can pull that case straight away. I can send a quick message to the officer who might be 100 miles away to say, I'm now picking this case up and I will call you in 20, 30 minutes when it's completed. And they can then get on with that interaction with the certifying doctor through whatever electronic means is necessary or by telephone. We are restricted with death certification because you still have to fill out the book. And until the death certificate is digitized, we can't get around that step. But of course, the legislation across both countries, of course, has allowed us to scan and send those records, again, without any hindrance. And I think that really the vision, I think that we had from the beginning, to be fair, that was very much held by both Welsh Government and the health boards, was that we would do this on a once for Wales basis. And as long as you've got the mechanisms for transferring information friction-free, then you can do that. But just a final shout out for Welsh Clinical Portal, because I've always been a flag flyer for it as a pathologist in my health board. And I don't think we would be able to manage our record scrutiny without access to WCP. We've become very, very heavily dependent on it now because of that all Wales access and that all systems access. And as WCP keeps growing and keeps developing, that just makes our life easier and easier to get access to quick information, particularly in such a time-sensitive manner that I've described. And that death certificate for a faith-based funeral, that registration could take place by lunchtime, the case having come to us by 9 o'clock in the morning.
Ridgeon, you want to come in?
Thank you, Jason. That timeliness is of course the real benefit of an electronic health record. So having provided pathology, having provided imaging, having provided an outpatient record of the patient, we've now provided the emergency service, the Welsh Ambulance Service record.
Yes.
And we've digitized the Welsh nursing care record. So the nursing element of the care can be scrutinized in a legible fashion.
Yes.
We've got future ambition for the delivery of an inpatient record that is electronic, and I'm sure you would look forward to that because the handwriting of colleagues, it takes some scrutiny. So my question to you really is what do you think we as an organisation could improve that would help this service in the future? Where do you feel the gaps are in that content?
Okay, so in fairness, with digitization of the nursing record, we're really then only left with, if the medical record then follows, what are we really left with? What's important to us? Automated news would be really good.
So the scoring system, yes. Yes,
so the National Early Warning System for a deteriorating patient. So for those of you who are not medical, clinical, a measure of things like blood pressure, heart rate, etc., turns into a score. And that's an important way of measuring and determining that a person is getting more sick in hospital, and should they have been acted upon in an early and timely way. Because one of the questions we will ask is, was there a problem of detecting a sick patient? So not having to rely on scanned news charts would be really helpful, because one of the problems with handwritten news charts, if I may say, is that people can add them up wrong. And we've had a few cases where we've identified that the news wasn't acted upon, not because there wasn't a system in place to act upon it, but because it wasn't added up correctly.
So clinical decision support will come in to be very helpful in that situation.
Absolutely. So that would be one. An automated, and then the other one that I think springs to mind for me is an automation of prescribing.
There we are.
Because at the moment, both drugs and fluid charts can be quite time consuming. And because we're going to have to scrutinize 34,000 deaths, one of the things that I'm always on about for medical examiners is I need the maximum out of you in the shortest amount of time. Sorry to say, it's like everybody, isn't it? And that can make reading handwritten charts can be difficult. There's all sorts of things that get crossed off and scribbled out, and if I may say, that's more likely to feed into problems for the healthcare provider as well, because at some point, reading, we will bail out and we will say, we don't know, and therefore it's a concern, it's an issue, over to you as a health board to look at. We're not here to investigate your death, but because we can't now find an assurance because of how we interpret the information that has been handwritten, we will create more cases for them to look at that second stage of review. If we're able to review documents that have not been handwritten and are easy to follow and have been digitized, I think the chances are we would send back at least proportionally of fewer cases, because there would be less room for uncertainty, if you like. Those are the two that spring to mind.
That gives me a list to work with. So great.
List of two at the moment. But the ambulance record, just to touch upon, has been fantastic for us because of the concerns that families will raise about delays in attendance for an ambulance. Now, we can now see that really, really clearly, as opposed to a scanned carbon sheet that we used to have.
Yeah.
And of course, in answering all the other questions, we can then offer an assurance to the family that, yes, we note that time frame, but we feel that this wouldn't have made a difference to the outcome. And because we are independent, that can then offer an assurance to a family in those cases where we are able to say that.
Thank you. And Marilyn.
Jason, thank you very much. Really enjoyed the presentation. I just wanted to say to you that example you gave about somebody from a minority ethnic community was really sort of well, really fantastic, really. But I just wanted to check, how does that get flagged? So you were saying that, you know, if it was needed urgently, I just wondered, what is the system that does that? You know, that
yes,
would create that consistency across the board.
Yeah, the driver, Marilyn, will almost always come immediately from the family. So what we found in all the cases that we've seen so far is that the family will drive, which actually, think back to my first slide, where we put the family at the center of it. Some families may want 1 to 2 weeks of having their questions answered before they're even prepared to think about having a funeral. Other families will want a quick funeral for the reasons that you outlined. We need to put all of those families at the center of our service, regardless of what their needs are. We need to be able to flex across that board. So the families will immediately say, and it's usually the bereavement teams in hospital that will contact us immediately and say, we've got what we call a faith-based death. I don't know if there's a better term for it, but we'll use that. And so we get that flag immediately. And we don't question it. We don't go into depth about the whys and wherefores. We just accept that that's the information we're given, and therefore we can prioritize that case. Is it likely to come from elsewhere? We can't assume a faith-based funeral plan for a family based on what data we might have on ethnicity. And ethnicity, of course, is declared, isn't it? So so generally speaking, it's going to be a driver from the family. So one of our public communications is got to be about eventually, how do families know that they can ask for that expedited arrangement, because they must be able to have it. That's why in Wales we're very confident we can run a 7-day working model. Weekends won't be the same, but we are absolutely confident that we will have a full ME scrutiny process for all faith-based deaths, regardless of when they occur. It doesn't need to be at 3 a.m, but that within 24 hours we will have access to medical examiner and officer staff on weekends and on bank holidays.
Thank you for that, Jason, because that's what was going to be my question, was about how people find out, but that's something you've already looked at. So thanks for Diolch.
Thank you very much, Jason. Ridgeon, is there anything you wanted to come back in any concluding remarks before I thank Jason and move on?
My only comment, Chair, would be that, as you know, a strong ambition to improve the content of the electronic health record, both for the delivery of direct care during life, but also to ensure that the timeliness response of the service to release the body appropriately to the family in their period of stress. So I think we're on a good journey. There's more for us to do. We've got a list, and we need to tackle that inpatient record. And there will be a dependency on infrastructure, hardware, the connectivity, the kit that we're constantly talking about, and that's going to require a predictable revenue investment, keeping things up to date. Keep the lights on, keep it available. Jason highlighted the requirement for this to be available all the time because of the dependency of the service that he leads. I'd just like to thank Jason for that presentation. Lovely to see you.
And thank you for your partnership. It's great to be part of an all Wales endeavour. So thank you very much, everyone.
Yep, and thank you, Jason, for really interesting presentation and in a very important area for obvious reasons. So thank you very much for taking the time to present to us today.
Thank you.
Okay, if I move on then to the next part of the agenda and move on to my report, which, as I mentioned at the last meeting, becomes my report and the Vice Chair's report. So if I pick, there's 3 or 4 things I'd just like to draw your attention to. Obviously, if you've got any questions on any of the items in my report, then please do put your hand up and I'll endeavour to answer them. On the first, the digital programme governance independent review, there's been no further progress as of yet, beyond what is mentioned in the report. But I am hoping over the next day or the few days, certainly week or so, that there will be some further discussions around that, about where how that will conclude and what the outcome will be. So I'm very much hoping by the next formal public meeting we'll have some be able to report some progress and some conclusions on that issue. The next one I'd like to really is just to I think it's because it's really important to take every opportunity to highlight the critical importance of cybersecurity, and you'll see that we are organising and the Welsh Government CDO, NHS CDO, is chairing an awareness raising webinar, and this is being invitations for this are going out to all health boards in Wales, and then they in turn can extend the invitation to others in their organisation. It is so important that we keep the foot on the gas around awareness of what needs to be done to ensure the greatest possible cybersecurity. You'll see that Helen and I met with the Llais, which is the organisation that's taken over the functions and responsibilities and additional functions and responsibilities from the community health councils. So Helen and I met with the Llais CEO. I think one of the interesting things to come out is they're very keen for their board. She's very keen for their board to hear about the work that we do, the scope of the work that we do. So at some point in the not too distant future, we'll be presenting to their board at one of their development sessions on on the work of DHCW and indeed the wider digital environment, because I suspect that clients are going to be particularly interested in some key aspects of our work and the wider digital work. And finally, just draw your attention to the last item, a publication that we produced in partnership with the Bevan Foundation, which I'm sending out widely to stakeholders. I know Helen is doing the same. You'll see a link to it in my report. Please do have a look at it and share it as widely as you wish. And it showcases work that's going on in the digital field around Wales in the healthcare system, and also sets out some of the challenges, but more importantly, some of the huge opportunities that are there for us to take in the future. So it's as I say, the link is in the report. Please do have a look at that and share it as widely as you wish. Those are the items I wanted to raise. I don't see any hands up. Ruth, is there anything particular you'd want to pick out in your bit of the report?
Nothing to add, Simon. Just happy to take any questions.
Thank you, Ruth. Rydian has one, and then Marion.
Thank you. It's regarding 3.8 and the All Wales IM Digital Network. I think this is an important forum, and I'm interested in where it might report to. And I wonder if you could highlight where the discussions and the reports go to in terms of escalating many of the digital aspects that we're linked in. Right.
I'll say a couple of sentences and maybe hand over to Chris then, just to do that, and David might want to come in as well. I mean, obviously we get a report through into us via David as chair, and then in the future David as vice chair, so it comes into us. Beyond that, I think it's the responsibility of the individual digital IMs to take through in issues or discussions through into their board environment. Chris, is there anything you'd want to add to that? There's nothing formally in the context of, as is the case with all peer groups, really.
Yeah, absolutely, Simon. So it's a peer group, Rydian, so it's not a decision-making forum. That said, the highlight report that goes to our board goes to health board digital committees, and the digital leads take those through for discussion and information. The evaluation that's set out in Simon's report is being discussed at the chair's peer group. Again, also a peer group, so not a decision-making function. I think it's fair to say one of the benefits of a peer group is influence and sharing information. So the peer group itself has very much been in that space, and I think will continue to be so.
Does that pick up on your point, Rydian? Not. Yep. Thank you, Marion.
Thank you, Chair. I'll be speaking in Welsh if I may. I'm interested in the meeting of the Vice Chair with the Future Generations Commissioner, and this, of course, is very timely as we formally come under the requirements of the legislation from next spring. Of course, we regularly refer to this pioneering and innovative legislation in our discussions, and of course, this is included in one of our papers before us this morning. But my question, Ruth, is, are we finding that there will be additional implications for us as an organisation in light of this change? And in what way, perhaps, will we be required to reconsider our priorities and our strategies and policies in light of the fact that we come under this legislation? Thank you.
Helen, are you wanting to come in on in response to this, and then Ruth, you can pick up on anything? Is that, go on then, Helen.
Yeah, no, thank you. Thank you for the question, Marion. I think, yes, we come under the Act from next year, but actually we do already kind of adhere to the principles of the Act in the work that we do. We include kind of a map of our plans and activities under the themes and the principles set out in the Future Generations Act. So I'm not anticipating that it will be that bigger change for us, because we already kind of, you know, it's as you say, it's groundbreaking legislation, isn't it? And something that we as an organisation really value and want to make sure that we are doing our bit, if you like, in terms of the taking the act forward. We're also meeting with the Future Generations Commissioner. I'm not sure actually, Chair, if that is in the diary. It's being arranged for the Chair and I to meet with them to ensure that we have, you know, totally aligned, and that we can help in any way that we can in terms of the agenda and the new priorities that Derek may be coming up with. So yeah, I don't envisage a whole heap of change for us, because we already see ourselves under the Act.
Anything you want to add, Ruth, in the context of the meeting?
I mean, I think it's just from our perspective, what it looks like the new commissioner wants to do is to concentrate on a few priorities, rather than previously in the setup of the commission they've looked at everything. So I think the work that Derek is doing now is largely trying to narrow down on what those few key priorities are going to be his focus for. So there might be something that comes out of that for us that we need to look at. And he's very keen on how he then measures the success of the Act as well. So in terms of what we do, I think we're probably placed very well to respond to that when they come forward with the set of priorities. But it's about narrowing it down, I think, I get the sense, rather than up until now it's been looking across the whole piece of the Act.
Yeah.
Chris.
Yeah, it's just to add to what Helen said, we've been engaged as one of the new bodies to come under the Act from next April, along with others, partners, CDPS, Welsh Ambulance Service, HCIW, on a knowledge exchange programme that they're running, which has been really helpful. So they've showcased some of the best practice from other organisations that are currently under within the legislation of the Act. And that's been helpful for us in learning leading up to April.
Thank you, Chris. Any other questions, comments? So you okay, thank you all very much. So you're asked to receive that report, which I'm sure you're happy to do. If I move on to item 4.2, the Chief Executive's report, and over to you, Helen.
Yeah, thank you, Chair. Just a couple of things to pick up from my report for this month. You'll recall from a previous listening and learning session that we heard about the work that we do to support the prison services in Wales. So just to highlight that we've entered into a service level agreement with NHS North Health and Justice Information Services, because they will provide second line support for the support that we provide to the prison services. So that's really helpful, and it's great that we've been able to enter into that agreement. We touched earlier on the accountable officer letter, and we will, Mark will clarify or go into a bit more detail on that when we come to the finance section. Just to say we had the response to the original accountable officer letter I sent in, which was outlining that we didn't have a balanced financial position to support our IMTP. We have since met with Welsh Government to work through the options and choices that we have as an organisation to try and achieve a balanced annual plan, at least going into next year, and we will touch on that more in the finance section. But it's been the focus of a lot of work by particularly Mark and Claire and the finance team, and by the exec team over recent weeks, and we've had some good conversations and support through that from Welsh Government. And then just finally, really, the last two bits to pick up on are the staff conference. I just wanted to call out, really, fantastic engagement with the staff conference at the end of April. I think we had over 700 of our staff actually virtually attend the sessions on the conference over the 2 days. A huge amount of engagement and energy. Actually, I just want to take the opportunity to thank all the contributors to the conference on the day, both externally and internally. Fantastic to hear all the great work that's going on, and the horizon scanning session. So we're in the process now of taking the evaluation and feedback that we've had from staff, and already started to plan next year's event. So really great, and a thank you to all involved and all who made it such a success. and that we had our second awards, DHCW a recognition award ceremony on the 27th of April. A great evening. We had over 170 nominations for the awards. I mean, we were flabbergasted, to be honest, that there were so many, and it was great to see all of the, really what's heartening, I think, is that this is staff kind of recognising and nominating staff. So that, you know, really chimes with the values and really kind of extol the dedication really and commitment of the staff that we've got there. So it was great. It was a great evening. Thoroughly enjoyed it, and looking forward to next year's. So thank you, Chair. I'll take any questions.
I've got a couple of questions. Marion first, and then Alistair.
Diolch Cadeirydd, a gai ategu geiriau Helen, a fi'n hyfryd bod yn y noson o brwyo ac mi oedd yna awyrgylch wirioneddol fendigedig ac yn braf gweld gymaint o staff yn cael i gwobrwyo a dathlu llwyddiant ar draws y trwch wir. Mae'n cwestiwn ni yn ymwneud ag cyfarfod y grŵp arweinyddiaeth, Helen. Chi'n cyfeirio fanna at ffocws ar yr iaith Gymraeg, ac o'n i just yn meddwl tybed, oes na oblygiadau i ni fel bwrdd o'r drafodaeth yna?
Oh, thank you. Yes, this was the leadership board in April, and the National Centre for Learning Welsh actually came to talk to us about the work that they're doing and the fact that they're developing a programme for the NHS. There's about £1.5 million worth of budget that's been assigned to help kind of, you know, increase Welsh language within and across the NHS. So they came to talk to us about what that programme could look like, and provided a few options. And I think there's more work to do to understand that, but one of the options that, well, certainly the leadership board were really keen on was that perhaps we need to have some dedicated assigned resources to each organisation in Wales to really kind of increase the confident use of Welsh, so through sort of confidence building tutors. So not sure of the exact detail of it and what it means for us, but that sounds to me really positive. So I was quite keen that we had that kind of you know, designated resource for us as an organisation. So I'm sure will be that conversation will be taken forward with the Welsh Language Managers Group. But yeah, really good to see that on the agenda, and a great discussion about it.
Thanks, Helen. Alistair.
Thank you, Chair. And it's great, Helen, to see the level of staff engagement, absolutely tremendous. And the sessions that I was able to join, I thought they were really informative, really engaging, and, you know, well done to everyone involved in it. I just wondered, however, on those who didn't engage, which is still a relatively significant number, are we able to, as it were, digitally identify who didn't engage such that we could reach out to those and perhaps engage in a more direct way, or even a short version follow up to just make sure that they're not left out?
We don't check, you know, individuals who will have attended the sessions, but we have, the sessions were recorded, so there is the ability to go back and look at many of the sessions that were on there. And I guess through team meetings and through kind of the directorate, you know, process, I'd expect that we're having conversations in teams about those sessions, and hopefully you would hope that line managers and team managers would be targeting kind of the sessions that they would want their staff to listen to. But I think, you know, it was 700 of 1100, so you're right, there's about 400 or maybe 300 or so that, and we don't know if they're the same 300 either, do we? You know, that's part of the challenge there in these things. So I think it's, you know, it's a great representation for the organisation, but yeah, we can't sit on our laurels on this. And we do have as well the 10 talks, and that go on, you know, quite frequently actually. And I think, in fairness to Ivan, he did one just last week that had 450 of our staff actually involved in understanding and hearing about the IMTP and Mission 1. So I take comfort that there's a lot of engagement, but you're right, Alistair, we should constantly be checking that we are reaching everyone in the organisation. And I think that is part really of the work that we will all be doing, but led by Sarah Jane and her team in terms of the leadership development agenda and ensuring that, you know, we have good, strong leadership right throughout the organisation that actually is ensuring that the staff are hearing and engaging in all of the things that we want them to engage in. So not an exact answer, but hopefully gives you some assurance.
Thank you, Helen. I've just got one question. I hope I'm not going to embarrass myself and I've missed it, because I thought May was the month, and it's nearly finished now, that we were given for the publication of the Welsh Government's digital health and care strategy. Have we got any update on when we can expect it?
Yeah, I think it's moved to June. So the latest I've heard is it's with the Minister's office, and I think we expect some kind of publication of it in June.
Okay, thank you. Okay, thank you very much, Helen. Thank you for your report. And we're obviously asked to receive that report, which I'm sure we're happy to do. If we move on then to the next part of the agenda, looking at our strategic items, and the first is the strategic procurement report, and I'll hand over to Ivan Evans, the Exec Director of Strategy, who I can see. Oh no, we can see Michelle. I saw that you had joined us, who is joined by Michelle Sell for this item. Ivan, over to you.
Thank you very much, Chair. As members of the board will know, there are many of our services that are delivered through commercial suppliers, and we manage those through contracts. The commercial team is a very busy team throughout the year. April has been unusually and extremely busy, and there's quite a full report coming to you today, and I will hand over to Michelle, our Chief Commercial Officer, to talk you through the report in the usual way. Thanks.
Thank you, Ivan. Good morning, everyone. So as you can see from the report, there are 4 contracts that I'm presenting today for the board, for the approval of the board to move forward to award. In my usual style, we'll take one at a time. I'm just going to run through some high-level details. There's a lot more detail in the report itself, and then happy to take questions, and I will pause after each one just to confirm the board is happy to move forward. So the first one, this is quite an important agreement for us as an organisation. We've talked a lot actually about our resourcing, some of the challenges with bringing in specialist resource and recruitment. I can see Sarah Jane there. Sarah Jane actually chairs a strategic resourcing group where we spend a fair amount of time thinking about how we can move forward and increase recruitment, and also, as I said, bring in external resources. And that may be two main drivers for that, really. One is because we perhaps have a challenge in recruiting, or it's an area it's difficult to recruit, but also because sometimes we need very specialist resources, and it makes sense to use a commercial provider to supplement our skills in that way. So we did a bit of a review in terms of the agreements that were available to us, and we decided that it would be useful to have a framework agreement, a specific framework agreement for DHCW. And the thinking behind that was we wanted to identify a number of providers so that we had choice, we had options in terms of the resources, and we maintained competition, but a small list, if you like, sufficient that we could develop more of a partnership way of working with those providers. They would get a better understanding of us and our specific requirements, and we would work more effectively with them. So that was the sort of thinking, and we ran a procurement. We ran an open procurement so that anyone could request to participate, which has led to the proposal that I'm putting to you today. So the framework that we're proposing to award, it's got 3 main lots on it, so 3 main categories of a support provision, which link to the competencies and the expertise in each of those areas for those specific resources. So 3 lots. The first, which relates to planning and delivery type resources, we are proposing to award to Trustmark and TPX Impact. So the second lot is for specialist application development resources, and we're proposing that is awarded to Kainos and TPX Impact. And lot 3, which is for specialist infrastructure delivery type resources, we are proposing is awarded to Trustmark and TPX Impact. So you can see there is some overlap there in terms of the suppliers, and those are all suppliers that are known to this organisation. So we've worked quite effectively with those suppliers to date. Trustmark are actually our Microsoft licensing agreement resellers, so we've tended to work with them particularly around the Microsoft suite I think this agreement allows us the opportunity to broaden. Obviously, they have a wider range of skills and experience that they can bring to this party. Again, TPX have worked with us. We've done quite a lot of work with them around our transition to cloud, the rollout of our Office 365 suite, etc., which has worked very well. And colleagues will probably recognise Kainos working really well at the moment in terms of developing the NHS Wales patient app with us and with our team. So a bit of a track record there and understanding of those providers, and I think in some new opportunities that this framework would present going forward. You'll note in the papers we've set a maximum value on the framework, which is £10 million. That is an absolute maximum. There's no minimum number. There's no commitment to award business, and obviously any business that we do award is either through a work package, so a definition requirement and a little mini competition, if you like, under the lot. There is the ability to direct award should the circumstances be appropriate, and there'll be some clear controls around that. But any work package or indeed award would obviously be dependent on specific requirements in year and the funding availability in order to support that work. So we've notified Welsh Government in understanding orders that we are proposing to enter into a contract. And I'm very pleased to say that today Welsh Government have confirmed that they've noted our intention to award. So subject to this board's approval, we can progress to award that contract.
Well, unmute myself. Okay, thank you, Michelle. Any questions? David?
Yes, thanks, Michelle. I fully support what you're doing and would approve the approach. 2 questions really. First is, we didn't get any responses to lots 4 and 5. So do we have a plan of how we might secure some resource to cover those elements? And the second point was, we didn't get any bids from Welsh-based companies, which is unfortunate. Are there anything that we can learn from the procurement that might help that when we go back to the market again?
Yeah, thank you, David. 2 really good points, and there's something we discussed both of those quite a lot actually in the strategic resourcing group and at the exec level in slightly different perspectives. I suspect though the answer broadly is similar to both questions, that we need to really look at our market engagement. I think, and we need to understand, we need to be engaging more widely, particularly in the Welsh marketplace, and thinking about how we engender interest in what we're doing as an organisation, how we kind of link into the drivers and the capabilities that are available locally. I think I put a note in the paper, and that's something that we will still pursue. So awarding this framework doesn't log that out actually, and is still something that's really important to us. And I think it's something that we have had a degree of success in the past, and we really want to continue with. So we're looking at what we call our strategic supplier engagement. I know you're going to be talking about the engagement plan, I think, more generally, but particularly our strategic supplier engagement. And for me, that includes how we can engage more effectively with the marketplace and understand how we could, create that alignment. It may be that would be for specific requirements that we would look at that might fit in more of a niche area, but we'll be looking at that, and I'd expect to be providing further updates on that as we move forward.
Yeah, thank you, Michelle. Is the point I was going to highlight really, or is that it's in the last paragraph of this section of the report, which is something is really important that we work as hard as we can to identify ways in which we can go out to the Welsh market to seek support. So I particularly look forward to that coming back to us in terms of how we're going to do that. Okay, thank you, David, for that question. And are people happy to support the award of these 3 lots? Yes, thank you very much. Moving on to the next one, Michelle, system integration tool, Fiorana.
Thank you, Chair. So as you say, contract number 2 is for our system integration tool. So this is a key part of our architecture, really, in terms of the way, in my simple terms, if you have a complex question, you can ask Sam. But in terms of the way we message between our systems in the architecture. So it's a key product that sits right in the heart of the services that we deliver. We run a product from a company called Fiorano. And we were keen to ensure that obviously we've got stability and robustness within the architecture. Again, we are looking at that as we're looking at a number of areas as we move forward, and there will be a review ongoing in terms of our medium to long-term plan. But certainly in the short to medium term, we needed to ensure we could continue to run that product. So we ran a procurement. It's under an NPS framework, which is a Welsh established framework. So we don't require a specific Welsh Government notification agreement on this kind of procurement because they've already noted and agreed the framework itself. We are proposing to enter into a contract for 3 years. There's some optional extensions as here at the end of that while we work through our future plans. There is a correction and apologies to the board. I just want to be clear. The number on the cover report needs to be updated in the detailed report. The committed expenditure or maximum committed value under the contract is just over 5.3 million. That is the correct number. So we will get that corrected on the cover report. That is for the full potential term. There are also some optional kind of call off resources that we may wish to utilise. Again, there's no commitment to taking those services, so that would depend on the work as we move forward for the team.
You're on mute, Chair.
Apologies. All I said was David, then Rowan.
I should do a better job of lip reading, Simon. Thanks, Michelle. I fully support the proposal to place contract. I have a questions probably best directed to Sam Lloyd, which is we're moving from version 10.3 of Fiorano to version 14, which is quite a big jump. Sam, is there much work involved in that? Because resource in this area is required by lots of our programs. So I'm just wondering how big a task moving from 10.3 to 14 is going to entail.
Yeah, thank you, David. It is a significant task. We've done a Fiorano upgrade before, and it did take a significant amount of resource. So we're in the process now of establishing a proof of concept to help us work out exactly what the process of the upgrade will be and how much resource is going to be required. But it is our expectation that it will be significant.
And we have confidence we can manage with the resources we have to achieve.
I think we're expecting to have to bring in some additional resource to do some of the work. There is the potential to use some consultancy with Fiorano. There's some call-off arrangements there that we can use. Possibly we may need some third-party support as well. And so we're working that through.
Rowan and then Ruth.
Again, probably one that is more directed at Sam Lloyd. Sam, so yes, we need to do this with Fiorano because it is part of our current architecture, but we also have a stated ambition to move to open standards, particularly HL7 and FHIR, I think. So really, we've got resource that we need to use to make sure we've got the Fiorano architecture running. But there's also additional resource and investment required to achieve open standards. And so can you talk about sort of the extent to which that investment is covered in the current IMTP? And also maybe some of the challenges for us as an organisation if we're not able to make the moves to an open standard architecture in the timeframe we would like.
Yeah, thank you, Rowan. So
we talk about technical debt all the time, but it's quite an anodyne phrase. It doesn't really bring home some of the compromises we're being asked to make, I think.
Yeah, so at the moment we've got somewhere in the region of about 320 different connections that run through Fiorano, which is, it acts as our enterprise messaging, enterprise service bus effectively. So it really is a fundamental part of our architecture, which is, moving to the latest version and then understanding what a longer term strategic direction of travel is going to take some time, as I say. I think the move to APIs and open architecture is not going to completely remove the need for an integration fabric. So I think we're going to still have to retain that under all of our possible strategic outcomes. So we've got several strands of work at the moment. One is to undertake the upgrade, as I say. The other is then to look at what the strategic way forward for integration is, and that may be that we stick with Fiorano, or it may be that we move to a more of a platform service from one of the cloud providers. And then the third strand is the move to open architecture and APIs, which is really being driven through the NDR program. So we've established an APIs team that we're running now who are working on a set of core integrations which we've identified largely pertaining to NDR and to DMTP, the Digital Medicines Transformation Programme. But then the wider sort of transformation of our underpinning data architecture and the movement truly to an open standards-based model is going to be driven through NDR, which is obviously a major programme which has got funding for a number of years yet, subject to approval of the business case and so on.
Thank you. Ruth, you did have your hand up. And are you okay?
It was a technical debt question, so I think probably Sam's answer has covered it. Thank you.
Thanks, Ruth. Okay, thank you all. Are you happy to support and approve this award, contract award? Thank you. Moving on to the next one, Michelle, number 3.
Yep, thank you, Chair. So contract number 3. So this is for our data quality system. Well, this is a service that we operate principally for the GP practices in Wales. So all of the practices use this system. It's used principally for purposes of data quality, auditing, reporting in terms of activity from the practices. So it's an important service for our GPs. We're proposing to award the contract to Informatica. Informatica are actually the incumbents. You may have noticed that there's the proposed award date was in 2024, or the proposed start date was in 2024, which may have raised the question. That's very efficient for the commercial team. But no, the planning around the timing was, had we identified an alternative provider, then there would have been a transition time to move from the incumbent to the new provider. It's important that this service is available all the time to the practices. So in actual fact, we've made the decision through a competition to award to Informatica, so that transition is not required. So we'll be looking now in terms of the alignment of the two agreements. But the proposal is to award for a 2-year period with the option for further extensions at the end of that, with a maximum value of £6 million. And that one is pending approval from Welsh Government. So we've issued a notification to Welsh Government of our intention to award this contract. So I would ask if the board is happy to approve the award, then we would wait for that confirmation from Welsh Government, confirm that with the chair before actioning the award.
Okay, thank you very much. Any questions? People happy to approve that award, contract award? Thank you. Moving on to the last one, Michelle.
Yep. Thank you, Chair. So the last contract.
Chair, Alistair had a question before you move on.
Sorry, that popped up just in time. Go on, Alistair.
Thank you, Chair. I was just interested, Michelle and I absolutely support and approve the contract. That you've opted for a 2-year contract with a 3-year option, whereas the previous one we opted for the other way around. I'm sure there are really excellent reasons for it, but I just wonder, is there a greater value were we to have gone for a 3-year on this one? And just a separate question. The developing scenario of pharmacies becoming more engaged in a variety of what have currently been restricted to GP and hospital activities looks like it's a developing scenario quite rapidly, potentially in the next 1, 2, 3 years. Is a contract like this capable of being extended if it is required to include pharmacies in that scenario?
Yes. So if I take the first question first, then in terms of the contract term, it's always an interesting one, actually, and that one, you're right, has got kind of a longer extension than the original term. Honest answer, my understanding would be it's about the flexibility. So we've got a sufficient degree of certainty over a 2-year term that we want to commit to this service. I think the fact that we've then got a number of extensions enables us to potentially vary the service or look at alternatives to the service as we move forward. So no firm plans at this point, but it is about creating flexibility. So they would have looked at that, and I'm not aware that there's any significant detriment in terms of the cost of that service as weighed up against the value, if that makes sense, which is why it's factored in that way. In terms of the pharmacy services, again, I haven't got the specific details of the contract in front of me. It would have been procured in such a way that we can support NHS use. Pharmacists, of course, depending on the contractual relationship, if you like, pharmacists tend to be private providers. So we would need to look at that in terms of our provision of services, although we do provide digital services through to some of the pharmacies. So it would be something that we'd have to look at that point in time in terms of whether this was an applicable service for them.
Thank you, Michelle. Thank you for that question. Okay, happy to approve the award of this contract. Everyone's frozen on my screen. I don't know if that's happening to other people, so I can't see. I don't see any, no indication of. Okay, thank you.
Chair.
Great. I can't see anyone nodding. So, okay, and then we're moving on to the last one now, aren't we? Yeah.
Okay, so final contract. So this contract actually relates to the telephony aspect of the contact tracing service. So colleagues may recall, in the early days of the COVID pandemic, we worked with Welsh Government and Public Health Wales particularly, but with the wider NHS to establish a contact tracing system, which was part of the service that was then rolled out across Wales, that stood up very quickly and very successfully. I think it'd be fair to say, and was an important service in terms of the Welsh response to the COVID pandemic. This service, or the contract that we're proposing to enter into, is really to ensure that we can retain this system in the event that that service is required to scale up again in the future. So it's a bit of contingency planning, I think, whilst we continue to work closely with Welsh Government and Public Health Wales. So we wanted to make sure that in the event that, as we say, needed to stand up the service, we would be able to do so. So you'll note that there is an initial commitment under the contract. So we're committing in year one to 300 users. At scale, during the pandemic, that was more like 3,000. So we've got the ability to scale up should we need to do so. There are then a couple of options on subsequent years, but that reduces to one user. So it really is a contingency at that point. And I think that really that goes to the uncertainty, I guess, or the recognized need to have contingency in place should we need to call upon it. And also there's obviously work ongoing in terms of what the future arrangement should be for a range of services. So it may well be that this is replaced or transitioned to a longer term solution which has wider use in the future. So quite a bit of flexibility in there. So again, the value stated on the front is very much maximum value should we be required to scale the service up and run it at scale in the way that we have in the past. And we are not required to notify Welsh Government, although Welsh Government would be very aware of our plan to enter into this contract, because this is something that we do working very closely with their strategic team. But because it's being awarded under an NPS framework that's already established and noted by Welsh Government, that's not a specific requirement under standing orders. We do, of course, require the approval of this board in order to execute the contract.
Thank you, Michelle. Any questions on this one, David?
Thanks, Michelle. I fully support the proposal to place this contract to provide some continuity of the service, which has done really well. If I've understood it correctly, the contract we're entering into, there's an element of user-based licenses and an element of core volumes. So am I right in thinking that the contingency is there, but we won't be paying for that much for it unless we need to sort of scale it up? Have I understood it correctly?
That's correct, David.
Yeah.
Yes, there is a commitment in year one to a minimum level of 300 users. So there will be a license fee associated with that, as I say, which reduces to one user in years 2 and 3, should we wish to retain that. And core volumes would be based on usage, which is, we wouldn't consider to be a significant investment at this point.
Thank you, Michelle. People happy to approve the award of this contract? Yes, I can see you all nodding now, and I think that concludes the contracts for this month. Yes, thank you.
It does. Thank you, Chair.
Thank you, Michelle. Ivan, I presume there's nothing you want to come back in on this item? No. Okay. If we move then on to the next item, which is item 5.2, the stakeholder engagement plan, and again, I invite Ivan to introduce this item.
Thank you very much, Chair. I've just lost my note. So I'll be presenting this item in Welsh. The paper is for noting, so I just want to give a brief summary over a few minutes on what's included. Sorry, I'm having a bit of difficulty here with my text. Okay, so this is a stakeholder engagement plan. There is an overlap with the engagement which is required with our suppliers. The engagement team is part of Michelle's department, so there's close collaboration, but I emphasize the stakeholders here rather than suppliers specifically. The board will remember that we discussed the plan in our development day about a month or so ago, I think it was. I'm very grateful to Nadine Payne, who's leading on this work, who is also leading that session, and others who've contributed to the plan that we have before us today. The headline is that we are not changing our stakeholder engagement plan. What we're doing is tidying up and refining a plan that we have, which follows against the strategy. There's no change in our direction, but we are trying to ensure that we have more confidence in terms of delivery. And the reason for that is, as you know, there is significant pressure on our resources across the organisation, across Digital Health and Care Wales. It's very important that we focus and prioritise our resources into the areas which are most important to us. And the original plan had, the strategy and the plan actually had identified hundreds and hundreds of stakeholders and over 50 action points, and that was a considerable amount of work as we established a new engagement team. So before I summarise the changes that are included in the plan itself, I just want to note that there's a need for us to do this in other areas across the organisation. Members will remember the discussion that we've had on the new IMTP and the system that we have there of showing where we have resources, where we need to ensure resources, and also you'll remember finance reports from Claire recently and the report from Helen and the discussion with Welsh Government in terms of the need for us to manage our resources, people and money very carefully in order to face the challenges that we have ahead of us. In the staff conference in April, I emphasised, and I've translated this, in English, it's work smarter, stay on target, and work smarter, not harder. In Welsh, work cleverer, not harder. That's what I've said in Welsh, but this is going to be really important to us. So to summarise what the plan says in its new format, firstly is that you'll see that there are 4 pillars, 4 thematic areas as columns. One is culture and the way of working. The second is more emphasis on partnerships, working with others. The third is leadership across the NHS and across the area of health and care. And the fourth is working more in a more agile way. And they are included in the paper that's been appended. In the table at the end of the document, you can see 23 actions. Previously, there were 52. So we have focused on 23, and there's a timeline for each of those. And there is a measure to give you assurance as members of the board and to us as delivery teams that we are delivering and that we can measure ourselves against that. And finally, it's not in the documents that you've had, but we will be appointing 3 members of staff working with Nadeem in the engagement team, new members, so that we can put additional resource into that area. Those resources come from other areas in my department, and that just shows how important it is that we prioritise. Everywhere that we put more resources in, we'll detract resources from elsewhere. So we have hard work of putting our resources against the areas of priorities that we have, and that will continue throughout the year. So I'm presenting the report to you for noting. I welcome any questions you might wish to ask or comments you'd like to make. Thanks very much.
Thank you, Ivan. Has anyone got any? Helen, you want to come in, and then David?
Yeah, just to say, I really welcome the work that's been done since Nadine has come into post, actually, in trying to kind of grab hold of this for us, I think. And I note that we're noting this. I think it's first, I'd like to voice my support for the direction of travel that's been clearly set out in the engagement plan that Nadine has put together, and for us to continue then to see that real focus. And it'd be good to get that kind of regular feedback to the board, I think, in terms of that more focused kind of engagement strategies that we'll put in place. So yeah, really welcome it, and good to see kind of the digital inclusion agenda having such prominence in it as well. So yeah, no, just want to say well done with that.
Thank you, Helen. And David.
Thanks, Simon. Thanks, Evan, for the presentation. Really good piece of work. Glad to see that you're putting some more resource into the implementation of it, which I welcome. The 2 points or comments I'd make really are from my own experience. The point you make about adding value and the value proposition, I think, is the key one for driving this. The more effort we can put into that, the better, because it's those messages that actually transform the relationships. And the other comment I'd make is there are a couple of peer groups, the Directors of Digital and the All Wales IM Digital Network, which are useful channels for those comms. So you might want to think about adding those in at some future update.
Indeed. Thank you, David.
Yeah, just David. Just.
Okay, anything you wanted to come back on, Ivan, at this stage?
Na, dim byd yn benodol. A wy'n ddiolchgar iawn am y sylwadau ac am sylwadau Helen. A wy'n cytuno, mae'r gwaith wedi datblygu yn y maes hyn, a mae hwnna yn beth i'w groesawu. A byddwn ni'n parhau i gadw aelodau bwrdd yn agos at y gwaith, achos fi'n gwybod bod aelodau bwrdd a diddordeb mawr yn hyn, a mae fe'n bwysig iawn i ni fel sefydliad yn rhan o'r Mission 5, Trusted Strategic Partner. Mae hwn yn rhan hollol seiliol i hynny, felly byddwn ni'n cadw fe'n amlwg.
Yeah, and I think obviously there's a role for the board, both collectively and individually, in our engagement. And I mean, nowhere was that better demonstrated than the joint meeting we had with Cardiff and Vale to work through some very difficult issues, but to work them through with a key strategic partner. Thank you very much, Ivan. As Helen said, we'll obviously we'll note the report, but obviously support the direction of travel and support the action plan that's been identified. Thank you. If I move then on to item 5.3, it's a strategic workforce planning update, and I'm going to hand over to Sarah Jane. Over to you, Sarah Jane.
Thank you, Chair, and thank you for the opportunity to open questions on the report. It's the first time in the DHCW's lifespan that we've actually collated this information. So it's been a joint exercise between my team and People in AD, Finance, and the Directorate Heads and the Deputy Directors to compile the information. And it's been quite illuminating and interesting, and hopefully you've enjoyed having a read of the report. What we've done this time around is combine the skills gap, training needs analysis and the workforce planning all into one exercise. So we're not going out to the business on a number of occasions and asking for different bits of information, but it's been very much a sit down exercise and working that through in a bit of detail. And the next steps on this, which will be at the end of this week, tomorrow, all the directors will have packs given to them through the Directorate Heads. And I went through this in a bit of detail at the Strategic Resourcing Group this week, which will then flush out some of those details, test some of those requests that have come in for training for the rest of the year, but also to look at the critical roles identification and single points of failure. So we're starting that work on the succession planning as well. So there'll be further detail to be borne out. And then a quarterly review, which will go into just the workforce planning exercise at directorate level, just to tease that out and to keep that up to date and to make sure that we're focusing attention and priorities in the right areas. So hopefully that was an interesting read for everybody, and welcome any questions.
You're on mute again, Chair, sorry.
Twice. Not good. Sorry. Okay, there's some questions coming now. What I was saying is I've got one while other people could think, identify if they've got them, but 3 came in while you couldn't hear me. Well done. David and then Alistair.
Thank you, Simon. Thanks, Sarah Jane. I'm really pleased to see the report and the progress that you've made on it. Particularly pleased that the concept of career pathways and mapping out, because I think that's key to retaining and developing staff. With regard to the future skills development, which again I would fully support, that will require some investment in terms of training for people to acquire new skills. Can I just check, have we got sufficient budget allocated, because I know things are tight at the moment, to support that in terms of what you've identified so far?
Yeah, I think there'll be a range of activities associated with that, David. So some of it's about identifying what we've already got in-house and ensuring that people can be released from their role for a day or half a day, whatever the training package is, to actually attend those modules. What we can actually offer through HCIW and other providers that are already in the Welsh economy, which we can tap into and get support. But there may be some additional funding areas which we might need to look at in a little bit more detail. So as part of the packs that are going back tomorrow to the directorates, we are then teasing out and finessing. So what are our priorities? What actually haven't we got at the minute that we can actually provide in terms of training? And then we will go back to our colleagues in finance and work through a bit of a joint plan through our strategic resourcing group. And we discuss this at the group on Tuesday in how we need to prioritise and look for some of that. So it's not going to be millions, but it will be, there may be some gaps, and we need to look at how we maybe disinvest in other areas that aren't going to be required, and then use that money, or even, you know, additional money if necessary, to look at how we move that forward in a different way. So we've got that. We've got the framework around that, but we need to work out some of the detail as we move that forward. So we're still in that check and challenge role at the moment, because the directorate packs go back tomorrow.
Sam, you put your hand up. Is it on this point, or is it a separate issue?
No, it's a separate point.
Okay. Alistair, then Marion.
Thank you, Chair, and thank you, Sarah Jane. I thought it was a really well set out plan, and very engaging to be able to follow and read. HR professionals all over the world are grappling with the impact of AI, and I'm sure you're very much involved in your thinking in how the organization itself would be impacted, or opportunities for that. I was a little surprised there wasn't any reference to it, Sarah Jane, in that. It seems that there are two fundamental aspects. One is, does our workforce have a level of concern about the impact of AI? And is that something that we need to address? And separately, are there opportunities for AI that themselves need to be embraced because they may not be capable of being avoided? Just wondered if you could perhaps just reference that.
Yeah, no, that's a really interesting point. And actually that's part of the next step stuff, really. So I've noticed that Ivan's put his hand up, because actually Claire and I were talking about this a couple of weeks ago in detail, because there was quite a lot of stuff in the media in that space. And I did ask Ivan, as our expert, for his guidance and support on that. And I don't know if you've got your hand up in reference to that particular issue, Ivan.
I have, Sarah Jane. So while we're talking, I've just asked ChatGPT to come up with something. So so now I'm an expert. I will. Rowan, I can see your head in your hands. Right? No, I have not done that. As it happens, tomorrow morning, Rebecca Cook, Rachel Powell, and I, and Bryn, our head of strategy, we're meeting with Public Health Wales, and we're meeting with HCIW to talk about AI and what its impact is. It has come on us and the rest of the world very, very quickly. So a lot of the data here was gathered at the end of March. You know, what's changed in the last 2 or 3 months in terms of generative AI, large language models, etc., is, I mean, it's astounding. And the speed at which Microsoft have been rolling out Copilot and a whole bunch of other things into Windows 11. I think there are two key aspects, and I think they're quite distinct. One is about AI in the context of clinical use and healthcare systems. I think we've got to be extremely cautious on that, extremely cautious. And then the other is using AI to help developers, and that is really going at pace. You know, Copilot embedded into GitHub and into various other things. So it's something that we need to wrestle with professionally as engineers. The slide which shows the training is described as a gap analysis. This is, if you like, organic requests for training that have come up from our staff across our teams. And it's really important that we understand that and that we respond to them. What we need to think about as well, though, is how we have the right balance between what's coming up organically from teams of what they identify for themselves, and the strategic direction that we want to go in as an organization, and what our strategy is telling us are areas where we need to strengthen our training, our capability, and our skills. And AI is going to have to be one of those, absolutely. And that we meet in the middle and we have the right thing. But this is a really, really good start, I think, to have the data, the information that we need to be more strategic in our planning of skills and productivity and training for our staff.
Marion, thank you, Ivan. Marion, and then Sam.
Thank you, and thank you, Sarah Jane, for the clarity of this update. It's really helpful. Probably wouldn't surprise you, but one point I wanted to raise, whilst you very helpfully provided a reference to age, geography, recruitment, and the skills gap analysis. There is reference to, very briefly, to the Welsh language and your hope to attract more Welsh-speaking employees. And we do know that there is a big gap here between the number of Welsh-speaking employees we have within DHCW and the numbers, the percentages of Welsh speakers more widely throughout Wales. And I just wondered, I know we will be getting a Welsh language annual report to the Audit Committee very shortly, and that will, of course, be highlighting any movement and hopefully some improvement in those statistics. But I just wondered whether you thought about incorporating the Welsh language into this wider workforce update rather than keep it completely separate. Because I think it might be helpful just to focus people's minds on the importance of this issue. I've always thought that meeting the standards should be a floor and not a ceiling, and perhaps to give it more profile within the wider workforce planning strategy would be helpful. Thank you.
Thank you, Marion. I think that's a great idea. And obviously it is an evolving model, so I'm more than happy to incorporate that. I don't think it'll be a problem. We do hold, as you say, statistics separately, but actually embedding it within the whole and utilising that and tracking that and supporting that is a really sensible idea, especially as we did that geographical analysis and actually the 6% in North Wales. So actually it does bed in quite well in terms of how we want to monitor and focus on some of that. So yeah, more than happy to incorporate. Thank you very much.
Thank you. Yeah.
Thank you. Thank you, Sam.
Thank you, Chair. 2 points. One on the AI question, just to note that we did have a session on Microsoft Copilot at the recent staff conference, and Microsoft actually came along and presented, and it was one of the best attended sessions at the conference. I think there's a great deal of interest from our staff and quite a lot of excitement, I think, around some of the changes that are coming, and particularly around the commoditization of AI and how it's being built into tools like Microsoft 365. I think there's a lot of opportunity there for us to use it. My second comment is around the strategic workforce planning and just how important continuing to do that is going to be for the next few months and years for us. I think, we're talking about the shift of product, we're talking about improving our DevOps maturity, we're talking about the cloud migration approach, and tying in a strategic workforce planning process to that is really going to be critical. We're going to it's going to be a challenge to attract the right skills in those fields, and we've really got to work on our employee value proposition, as I know Sarah Jane is. So I think there's quite a lot for us to get stuck into here. I also think, I'm really keen to continue to focus on diversity as we do this. I know that the gender balance in my directorate could be better, and I'm really keen to look at creative approaches to recruitment to work on that. So thank you.
If I may, Sarah Jane, that last point you made is one I was going to raise, really, because the slide you've got on the male-female split, which makes us look better than the industry, I suspect is a bit of comparing apples with pears, because I suspect the ONS figure is actually people in tech jobs. Whereas if the next slide you looked at where we've got the directorate profile by age, I suspect if that was broken down by gender as well, we'd see that it was a very different picture, as Sam has just highlighted. So I think we just need to be careful that we don't sit on our laurels and think we're better than the industry, because I think we are comparing a bit of apples with pears there on that slide. And my light has gone out, so I've gone dark. So Jenny Lee will now come in and dance in front of the sensor to turn it on. Rowan, you wanted to come in.
Just a comment really on Sam's point about improving gender diversity in his directorate. There are some really good, and I know Sarah Jane, we had a bit of a discussion about this when we joined, but there are so many fantastic women in DevOps, women in AI, and also organizations that I can think of. We have fantastic talent out of the armed forces, and Sarah Jane, you're incredibly well networked in there. But there is a specialist recruiter run by a fantastic Welsh woman that specifically seeks opportunities for forces spouses, some of whom are incredibly technically literate. So I think you know, there are real opportunities there, both to access sort of slightly less well mined sources of candidates that might give us a little advantage, and particularly to Sam's point about our value prop. You know, I think there's things that we can do in Wales and cuts across a lot of our objectives in terms of circular economy, etc., as well as maintaining quality in the organisation.
Thank you. Thank you for all those comments and questions. Thank you for the report. So, Jen, I was just trying to look in the cover note whether you give an indication of how regularly we're going to get this update.
I don't think I did, actually.
No, I didn't.
I mean, obviously, it's we are going to go out each quarter to the directorates as well as the monthly directorate meetings, just sort of work some of that through, because there are some changes afoot and the things will need to be worked through in alignment with that. I think in terms of the big exercise, we're going to run the big exercise once a year, which is the same as what happens across other areas of the wider NHS family. So I would suggest if there's anything that's probably pertinent that actually sort of moves us into a slightly different arena, I think it would be by exception, but I would suggest that we have that on an annual basis. Yeah. But by exception, if there's anything that we think we need to bring to board to draw attention to. Great,
that's very helpful, because we can schedule that into the forward work plan then. Lovely. Thank you very much, Sarah Jane. And we are being asked to note that report, which I'm sure we're very happy to do. If I move on to the last item before we break, which is the transfer of the iCare digitisation programme, and ask Helen to introduce this item. Where are you, Helen? Oh, there you are.
Thank you, Chair. Yeah, just a short paper to update on this. Colleagues will know we've discussed this previously in board briefing sessions, but the National Digital iCare programme, it's a Welsh Government programme of work. It's under the auspices of the Planned Care programme and the Ophthalmology Board. So it is it was put in place to implement an ophthalmology electronic patient record and electronic referral processes from high street optometry from primary care into secondary care, and actually refer back out where those referrals have come back in. And it's all about the, supporting the agenda of that kind of shift in left, if you like, in terms of the shift in the work out of secondary care into primary care as part of Welsh Government's strategy. It's been hosted by Cardiff and Vale since its inception. And since our establishment as a national digital organisation, we've been approached now for in conversations in the last 12 months by the SRO, who is Fiona Jenkins, who's the Director of Therapies and Health Sciences at Cardiff and Vale Health Board, has been leading this programme since its inception, and by Welsh Government to take on the programme. You'll see that was also a recommendation that came from the recent Gateway Review that Fiona as SRO commissioned just recently. Really what we're looking to do at the moment is working through the details of what the transition of the programme looks like. For us as an organisation, and getting underneath some of the detail of that. There's quite a lot of complexity to the programme and quite a lot of work still to do. And we would want to take some time when the programme transfers over, and it will, just for clarity, it'll transfer over to our primary community and mental health digital directorate under Sam Hall. And we have recently appointed a programme lead who is quickly getting up to speed in the last few weeks in terms of working with the programme team to get underneath all of the kind of progress that's been made and the plans that we need to move this forward. We'd suggest that we need to take a breath when the programme transfers to us to ensure that we can develop a full implementation plan that is deliverable, and we would need to do that in conjunction with colleagues in Welsh Government and with the existing board that it reports up to. So also worth noting that it's not just about the programme to transfer on the 1st, but there is a live service that's running out of Cardiff for ophthalmology services and optometrists in Cardiff and the Vale, and there is one clinic that is now live in Cwmtaf Morgannwg as well. That service, we will need a bit more time, I think, to work through what that means in terms of the transition and how we would take that into DHCW live service. So we see those activities going on in parallel over the next few months. So I'm asking the board to will have considered the paper and what's been set out and to approve the transfer of the programme into us as an organisation.
Thank you, Helen. I've got one question. Okay, Rowan and then David.
Helen, I think we all recognise that it's a national programme and it needs to be in DHCW. I also note that it's another national programme that's being transferred into DHCW, and I just wondered whether you could talk about your confidence in terms of the funding to be able to deliver this. We've already spoken today about, resources are tight, and there is a complexity within these programs and delivering them simultaneously that I would just ask for some clarification on.
Yeah, so we're working closely with Welsh Government on this one, Rowan. I think that there will need to be additional funding that goes into this programme in order to achieve the successful outcome and to ensure that we've got all the resources that are needed to do that. We're not clear what that is at the moment, so we've got some of that working out to do when we get all of that detail through from working with the programme team. So there's quite a lot of work to do, quite a lot of activity that Sam and the team are getting underneath at the moment. So I anticipate us getting kind of further information on that in coming board meetings and board briefings. But yes, my inclination will be that it will need additional funding to take this forward. There's not something that we will be able to consume given our current financial position.
David, then Marion.
Thanks, Chair. Thanks, Helen. Like Rowan, I fully support the move of national programmes into DHCW. I think that's the right place for them. In terms of the gateway review that's been undertaken, do we have a sense of the solution that's piloted at the moment, whether that's scalable or whether some rework might be required to make it scalable? And the second part of the question is, do we have a view yet on what additional resources might be required and whether we have them within the organisation or whether that's something we're going to have to recruit?
Yeah, so in terms of the scalability, clearly the programme will have designed and developed that in with the view that it will scale to all of Wales, to the ambition of the programme. But there is some work to do in terms of the shift of this into cloud technology as opposed to on-prem, David. So there is some work to do, and I think that there's some detail for us to understand exactly what is needed for that in terms of that kind of transition from on-prem into cloud, and then the further rollout that is then required. It will need additional resourcing. So we will not be able to absorb the work into existing resources. So we've got to work that stuff through. Hence me saying we need, to assess all that on the transfer. And we've been doing some of that work with the programme team now, and we will work some of that through with the SRO. And I've been corresponding with Fiona this morning on some of these issues. So I think that and when I say we want to pause, we want to just, do that, take stock and set out what that's going to need, ensure that we've got the appropriate funding, ensure that we've got it appropriately resourced, and then we want to really ensure that we can get this to a successful result for all of the organisations that desperately need to have this functionality in place in order to enact the service change that they want to enact in terms of the shift out to primary care. So we understand that there is a huge urgency around kind of a successful outcome for this for local services. So that will be front and centre of the the reworking of the plan and getting underneath that.
Thank you, Helen. Marion.
Thank you. And again, like others, absolutely support this transfer. It's the logical thing to do. But there are clearly challenges that have been highlighted already. And there appears to be quite a strong reputational risk issue for us here. And I'd be looking for some assurance that we've got an appropriate, or that we will develop an appropriate comms and engagement plan to ensure that we limit any potential damage to our reputation arising from some of the historic issues perhaps involving the transfer.
Yeah, I'd absolutely agree, and I think, in fairness, I don't think that there were sufficient resources within the existing programme in Cardiff that were enabled enough of that comms and engagement to happen in the way that we would want it to happen. In fairness to Cardiff and where they've been with the programme. So yeah, absolutely, those are the sorts of things that we've got to consider, isn't it, in terms of us having the appropriate level of resources in all of the right places, and that's about technical, programme delivery, finance, commercial, and in comms and engagement, and others. So yeah, no, completely agree, Marianne.
And finally, for me, Helen, I apologise if I couldn't see it in the report and whether you mentioned this and I missed it in your introduction, but the Gateway Review identified a series of critical recommendations, some of which are quite chunky in terms of work. All of the deadlines set for completion of those have passed because they were the 1st of May. Have they all been completed?
I think they're being worked through at the moment, and that's part of the work for all of those things. You know, we need transferred over, don't we, in terms of the programme artifacts, if you like, and programme resources. So I think a lot of that is being worked through. Some have been actioned, and the rest are being worked through. And we're trying to work alongside that work to ensure that we get all that information that we need in terms of the transition, Chair.
Yeah, it's just because what are we? Is it 30 or 31 days in May? But we're either 5 or 6 days away from taking over the programme. You'd want a certain degree of confidence that those had been completed, because it becomes that much more difficult getting information out if to complete things like the SRO should develop a clear plan with key partners to set out delivery of the artifacts, completion of the required approvals, and to bring the solution into life. So that's a huge thing to achieve. So
I think part of that is that we need to do that with the SRO, don't we? And I think the transfer, in my opinion, that's a difficult one for the programme to do where it's at the moment with the transfer pending. I think that's something that we need to work with the SRO to ensure that we've got a fully deliverable plan actually that's worked up with the service.
Okay, people happy to approve the transfer of the iDigitisation programme to DHCW, or that we accept it, I suppose. Thank you all very much. We'll take a break now. Thank you, Helen. We'll take a break now. It is 5 to midday. I suggest we recommence at 25 past noon. And if we could just be here, I don't know, a minute before that time so that we're all in place before the start. So we'll recommence at 25 past. And I've got a note here to remind people to turn off their cameras and mute microphones. And then it says including mine. So I'll see you all back here a few moments before 25 past midday. Thank you. Okay, welcome back, everyone. Just give it a couple of minutes. I think Ivan, great. Okay, welcome back, everyone, to the second session of today's board meeting. Without any further ado, move straight into part 6, the governance, risk, performance and assurance, and ask the board secretary, Chris Darling, to take us through the corporate risk register. And in addition, in this meeting, we've got the annual review of risk appetite. Over to you, Chris.
Thank you, Chair. Yeah, so this item is complementary to the next item on the agenda, which is the board assurance framework, which will look at our principal risks to our strategic missions. This item will look at our operational risk position. So I want to go through 3 areas. First of all, I just want the board to note the risk and board assurance workforce plan for 2023-24, which is included as 6.1i. I think it's a link to the papers, but that's our plan for the year in terms of how we'll track and manage risk and board assurance. I'm just going to work through our current corporate risk register position, and then finally I'm just going to share some slides and talk through our risk appetite position. In terms of our corporate risk register, there's currently 30 risks on the risk register. It's slightly less than the last board meeting. We had a discussion about the number of risks we currently have. It's down slightly. There's 17 of those are public risks and published within our papers. There's 13 private risks, which have recently been scrutinised by the Digital Governance and Safety Committee in private session. So I want board members to note our position in terms of changes since the last meeting. So there's been 4 new risks, 3 of which were private that have come on. There's been 1 new risk, the 0316 technical debt accumulation, that's in the public domain. I'm just going to ask Sam Lloyd if he would come in and just give an update on this risk, which he's approved since the last board meeting.
Thank you, Chris. So we've talked a bit about technical debt already this morning. This is not referring necessarily to legacy infrastructure in the sense of, we've got obsolete servers and hardware. This is more about the platform, the fundamental platforms, such as the fact that we've still got large reliance on our data centers. We've still got large reliance on the integration fabric that we talked about this morning. So this is really about looking at technical debt from the perspective of constraints on our ability to move forward in the direction of travel with sufficient pace in order to deliver the quality benefits that we're looking to achieve and the value benefits that we're looking to achieve. So really the mitigations for this risk are around the product strategy, the cloud migration strategy, the DevOps maturity work that we're starting to kick off. So it's really about securing our sort of medium-term ability to operate at the right pace.
Thank you, Sam. Continue to work through. Sorry, Rowan, do you want to come in now on this point?
Thank you, Chris. It's just, I think, Sam, that's a really great summary of what our technical debt means to us. I was sort of reflecting on how we build the case for investment in order to solve for this. And if we look across the NHS, I think externally it's very obvious that it's a very challenging situation, and it's things like waiting lists, people waiting for hips, knees is a very well understood. The consequence of not being able to do as much as we would like has this direct impact on provision of healthcare. And as we look forward to a healthier Wales, there isn't actually an explicit digital strand of the Healthier Wales strategy, but a lot of it requires us to solve for these technical debt challenges. Otherwise we won't achieve some of the benefits of a healthier Wales. And so really it's a comment to the board and something that may be a good discussion topic at another point, which is to think about how we make technical debt and the consequence of it as real to the wider stakeholders as waiting lists and hips and knees and everything else, because otherwise we won't be able to give the public the tools they need to engage with their health.
Can you hear me, by the way?
Yeah.
I've had a bit of a system meltdown, so I'm working that. I'm hearing through one thing and speaking through this. Ruth, you wanted to come in?
I just wanted to follow up on that point really. We also need to consider this in relation to our current stated risk appetite. I think really now we're entering a period where for the first time as an organisation, our actual stated risk appetite is going to come under stress. And we need to consider what that means for us, especially when we're thinking about concepts of technical debt, when we think about the financial situation that we are in and the forward look across the NHS. That actually when we next come back to this as a board, we might need to think about whether we are cautious, open, adverse in the right places, or what our tolerance is for changing some of those parameters.
David.
Thanks, Chris. Thanks, Sam. I just want to build on the points that Rowan and Ruth have already made. I've come across this a couple of times in my career, and it starts with we've got a lot of technical debt, and that sort of gets attention. But the only way that we'll actually break the logjam is if we can articulate the technical debt in terms of impact, in terms of service delivery, or so we've got to, as well as identifying it, we've got to in some way quantify what it means. And if we can do that, then it will certainly help with the bigger challenge we've got around changing the sustainable funding model. So fully support adding it, but my experience is we've got to make it a bit more real to the people that matter before we'll get any movement in terms of alleviation to solve the problem.
Sam, do you want to come back in on this?
Yes, thank you. I think they're great points. I think on the risk appetite point, I think that's something we're really going to have to consider as we start to plan out the mitigation strategy in more detail on this, because I think we will have options around cloud migration approach, for example, and how much lift and shift we do versus how much fundamental re-architecting we try and achieve at the same time, which will have potentially different benefits. It could be more expensive to do the re-architecting, but that could give productivity gains, which will pay off over a longer time. So we need to understand some of those trade-offs, and the faster we move, the higher the risk. So, I think that's definitely something that we'll be considering. And the quantification, David, is a really good question. Again, some of this I think will come out of the work that I'm hoping to kick off. So the cloud total cost of ownership activity is already underway. So we're working with Microsoft to understand what our options are around moving our current workloads into the cloud and what the potential cost differentials will be. Also starting to think about DORA metrics for the DevOps teams, and that we should have our first set of metrics, I think, by the end of next month. So I'm hoping to be able to share those fairly soon. Those two things will start to give us a picture of how we're constrained currently. It's not going to be the full picture. I think there's much more we're going to need to do. But I think it's kind of understanding the cost of the cost of the current constraints that we need to try and quantify, I think. Yeah, thank you.
Thank you all for that input. And I thought Sam's articulation would generate a bit of discussion, and this might be one we take offline in terms of how we track this forward, particularly thinking of a deep dive in this area through Digital Governance and Safety Committee. But I'll link with Sam and Rowan, if that's okay, after this meeting on that. Just to work through some of the other changes since the board last met, the board members will note there's 5 risks that have been removed. We talked at the last meeting about the significant number of financial risks that had come onto the risk register. I think Claire articulated that was likely to be the case at this time of year, but they would potentially, some of them quickly come off. So there's 4 finance related risks that have come off the corporate risk register. They've been downgraded. They're still being reviewed at directorate level, but aren't now showing on the corporate risk register. Just in terms of changes to risk scores that have stayed on the corporate risk register, 0299, supplier capacity to support the electronic prescription service readiness, EVAN update at the last meeting, that was likely to come down. That has come down since our last board meeting. There's 2 other corporate risks where the risk score has changed. And I just want to pause on these. 0237, new requirements impact on resources in the plan. So that's still a corporate risk, but it's dropped slightly. EVAN, do you want to comment on that one?
Thanks, Chris. I'll comment on 299 as well, if that's okay. But I'll take them in numerical order because that's the order of my notes. So 237, new requirements impacting IMTP planning. The main orientation of this is new requirements as opposed to new issues. So it's about stuff coming to us from other parts of the NHS, from Welsh Government and from elsewhere through new service requests, etc. Board members will know how much effort we've put in over the last sort of 6 to 9 months to tighten up in our IMTP, in our planning, in our prioritisation. And I think we've also improved our engagement with the wider system and with Welsh Government as well. We're working very closely with Mike Emery as the new CDIO. So I think it's a fair reflection to reduce the risk score slightly. I mean, we were still going to get new requirements, but we put a lot of effort into being able to handle and accommodate that better and respond better, so that we got a better understanding. The supplier dependency, I'd focus on the singular supplier. So there's a particular supplier that was behind this risk. And if you look at the detailed risk register, this is about our relationship with NHS England, about some core elements of electronic prescribing services. We've made good progress in mitigating that particular aspect of the risk, Section 255 agreements and so on. But there are other suppliers in the EPS space, pharmacy and primary care suppliers. And there are challenges that we think are emerging in those areas as well. So it's going down at the moment. It might well go back up, or it will come in again as a different risk, EPS suppliers dependency. But either way, it's not going away completely, and that space is going to continue to be a challenging one for us.
Thank you, Ivan. The final one was 0304, the NHS Wales SLA income increases. I know Mark will cover this to an extent in the finance update. You'll recall the last board meeting, this was our highest scoring risk. It's dropped slightly because of the number of letters and confirmation we've had. But I know there's still 1 or 2 where very recent discussions at CEO level have taken place. Helen, do you want to comment on the latest position for this one?
Yeah, thanks, Chris. So yeah, we're and Mark will cover some of this in the finance update, but all organisations have been given till the 31st of May to those that didn't submit a balanced IMTP to give their latest updated revised positions into Welsh Government. So we've got, I've had some conversations with colleague CEOs about some of our SLAs, so I'm expecting to have the outcome of that before we're able to submit then our accountable officer letter on the 31st. So I think it's right to reduce it, but it's still on the corporate risk register for the time being, as we still haven't got full confirmation from everyone that they are going to pay the SLA.
Thank you, Helen. I'm going to pause now and just ask the board to note those changes. I do, and Ruth's nicely given me a segue into the risk appetite section now. Thank you, Ruth. So I'm just going to ask Jen if she doesn't mind loading the screens, and I'll run through this section. So just to start with a bit of background, risk appetite is the level of risk that we as a board, as an organisation, is willing to accept in pursuit of our objectives. And risk appetite is a complex thing. It's not a fixed concept, and it's likely to vary across risk domains, as was referenced earlier. And it's important, though, for us as an organisation to agree a risk appetite position. It helps set the tone for us as a health authority. It shapes the culture, and it's very useful for us as a communication tool across the organisation. But it should be reviewed regularly. So we set our risk appetite position, and this work that we'll go through now builds on what we've previously looked at as a board. So I'm going to briefly take us through the slides, how we've defined our risk appetite position and our articulated risk appetite statement. The board will be familiar with a lot of the material from discussions from the board development day held in March. And I would like to thank Ruth, our vice chair, for reviewing and providing some feedback and generally being a critical friend when it comes to risk and board assurance and risk appetite. So if we move on to the next slide, the first thing we've done is define our risk appetite levels. So this slide highlights the 5 risk appetite levels we've used and the definition for each. So from a more cautious or adverse approach, where safer options are preferred with more controls in place, through to open, hungry, where fewer controls will be in place, and risk taking is very much encouraged. So if we move to the next slide, please, Jen. The traditional domains used for NHS bodies we've continued to use, but we've supplemented then with a number of more bespoke domains which feel appropriate for us as an organisation. So that's 10 domains. It should be noted that we have also allocated risk appetite position for each of our strategic missions, and we'll come on to that on the next agenda item. But if we move to the next slide, it will just show how we've interpreted each of those risk appetite levels across our 10 domains. So we have 3 domains. We have signaled we are we are adverse. So take the least risk around our compliance, adherence to legislation, patient and citizen safety, and information storing and maintaining. So in those areas, we would expect to see a high number of controls to mitigate any risks that we're taking as an organisation. We've then got 5 domains where we're cautious, so finance, safety and well-being, service delivery, reputational and information access and sharing. We've got 1 domain we've listed as moderate around corporate social responsibility, and 1 domain where we've said we are open, so we'll take more risks and have less controls in place around the development of services. So moving on to the next slide, we've translated that into our risk appetite statement. I think the key points to note here, DHCW, we've said, must take risks to achieve our strategic aims and deliver beneficial outcomes to stakeholders, but that risks will be taken in a considered and controlled manner. So considered will often mean escalation through to the board and controlled to a level deemed acceptable. But to pick up the discussion, the points made earlier, I think there are occasions where mitigating risk to a level that we want in terms of our acceptable risk appetite level isn't always possible. And there are occasions where we have to accept a level of risk. And I think it's important then that as a board, we have the discussion and accept the level of risk or not, and agree how we will try and mitigate it if we haven't been able to mitigate it down to an acceptable level. Finally, the risk appetite position will continue to be reviewed regularly, particularly as we operate in a dynamic environment. I know every year it seems to get more dynamic, there seems to be more changing, but it certainly feels like the case at the moment. So we spent a lot of time considering this, and we discussed this, as I say, at our board development in March. A lot of the focus then was around the finance domain, whether that should remain cautious, whether given the system within which we operate and the financial position we're in as an organisation, that should go down to adverse. But the discussion landed on that remaining at cautious for now, but for the board to keep a very close eye on that domain in particular. So if we move on to the next slide, this just translates how we try and use our risk appetite and tolerances to escalate risk. So risks in the categories where we're more averse and cautious, the risk rating tends to be lower before we ask for it to be escalated to the lead exec director for consideration to go onto the corporate risk register, and those where we're more open, we would accept a higher risk score. So if we just move on to the next slide, thanks, Jen. Just want to pause and talk a bit about risk culture before we move on and just review what we've done as an organisation, because culture and risk culture in particular plays a really big part in risk management. People's personal risk appetites can create imbalances in risk registers, and what's catastrophic or very important to one department objective may not be catastrophic to the organisation as a whole. So it's important for us to be aware of that. And as individuals, we all have behavioural biases that affect our decisions and the approach we take. So there's different types of biases: optimism bias, confirmation bias, but they may make us more or less prone to take risks in certain areas. So we try to guard against individual biases through that escalation process with risks not going onto the corporate risk register without the approval of the lead executive director beforehand. We're trying to ensure a strong culture and a strong communication around our risk appetite to ensure that people are aware of the organisational lens within which we see risk through risk and opportunity, and it's not just individual lenses. I've put a quote in here and it really highlights, I know we've had discussions previously about the importance of focusing on opportunities as well as risks. I think this one's helpful in that sense. Only those who will risk going too far can find out how far one can go. So if we move on to the next slide, just some of the things we've done. So we've done a fair bit of training around risk and board assurance. Bethan Walters, our risk manager, who's fantastic, has delivered over 90 sessions of training on DataX, our risk management system. We've done over 10 risk reviews in areas with directorates over the last 12 months. We've delivered 4 training sessions to senior managers on risk and board assurance, and had really good attendance, over 80% of the senior management workforce. As committee members will know, we've had a number of deep dives into specific risks, and we've done some analysis of long-standing risks on the corporate risk register. And we continue to do so, review the World Economic Forum global risk landscapes to get an international context of how we're managing, mitigating risks and identifying opportunities of the future. So just on to the next slide, I'm going to conclude with just some risk themes for us to consider. So going into 2023-24, we identified through the IMTP process where our highest risk themes areas, so threats and opportunities for DHCW, and those were cybersecurity and prevention and our ability to respond in the event of a cyber attack, supplier capacity to support the delivery of DHCW's priorities, digital inflation and the increased costs from suppliers in the environment in which we're working within at the moment, and sustainable funding, particularly for future years and how we achieve our objectives through a sustainable funding model. And then the last slide, just to finish off the last of the risk themes. Jen, if we, yeah, that's it. So resourcing, so this is very much around filling our vacancies and ensuring we don't have gaps in key digital skills areas. Legacy infrastructure, Sam's articulately described earlier. The integration between digital systems and the complex interdependencies they can cause. And finally, digital privacy and ensuring that we have robust information governance arrangements in place. So I'll conclude now. Jen, happy for the slides to come down, just to ask the board for any questions or comments, and then we'll be looking for support and approval for the articulated risk appetite statement.
I was just testing whether the mute works. I'm a bit of a technical debt here, Sam. Okay, thanks, Chris. Ivan, you've got your hand up.
Thank you. A comment first and then a sort of comment mixed question. So first, I really welcome the focus that we're putting on risk appetite, and I take a lot of comfort and assurance from the speed at which scores change and things move around in our corporate risk register. And I want to endorse what Chris said about the work that Bethan has done over the last year or so on reviewing our risks across directorates, keeping them live, and seeing that traffic. That indicates that we're actually managing risk and that we're using risk registers actively. And too often I've seen them in organizations, they become disconnected from the operations of the organization. The risk appetite thing, I guess I just want to sort of emphasize or suggest some of my perspective on this is that having an increased risk appetite doesn't mean a reduction in controls. Staff will know I like my quotes and I like my metaphors. Some of them might even remember my mirror signal maneuver approach to decision making and leadership. I'm not going to inflict that on you now. But if you're going really fast, then you need to keep your eyes on the road. So in those areas where we have an increased risk appetite, it doesn't mean that we slacken our controls, or that we take, if anything, in those areas where we're moving more quickly because there's greater opportunity, that's the sort of stuff that we need to be looking at more often, because controls processes are not necessarily the best way all the time to be managing areas which are evolving very, very quickly in an agile sort of situation. And then there may be other places that we've got a different kind of risk appetite. So I just wondered if Chris, you want to say anything, or if any other members want to say anything about that, about this balance between controls, as in documented processes and controls, versus paying very close attention in areas where things are moving because we want them to move more quickly, and how that relates to appetite.
Yeah, happy to come back on that. So I think that the key thing for me with I think there's a difference between risk appetite as you apply it to our strategic missions, which we'll come on to next, and those as applied to our operational domains. Operational domains, I think it is a lot easier to see the direct link to controls. So finance, we're cautious. Mark and Claire make sure there are controls in place so you cannot overspend. And if you do, you get red alerts, and you get my business partner telling me, tapping me on the shoulder. So I think there is a level of controls within our operational domains that are quite explicit. Within our strategic missions, I think it's much more nuanced. And I think that's one of the things we've learned through the board assurance reporting process. And if I'm honest, one of the things I've taken away probably from that journey in terms of the risk appetite we want to take to deliver and achieve our strategic objectives needs to ensure that we're taking the right actions to move that strategic objective forward, and putting lots of controls in place doesn't necessarily move that forward. So it's more about actions we're taking and that they're appropriate, and that there are guardrails to stop you from doing anything inappropriate.
Rowan. Oh, Rowan.
I'm just really responding. Thank you, Simon. I'm just responding to Ivan's sort of invitation to have a bit of a conversation there, I think, which is to observe that we're working in an environment that is both constrained and constantly changing. So there are external pressures and asks that we're responding to, and risk is one lens through which we look at that. I think in areas like service delivery, where we're more open, it's not so much about controls. It's almost the culture of the organization, the expectation of quality of work from our colleagues that enable us to have that much more open appetite for risk, because we're confident in our there's a universal understanding of the quality of work and the general behaviors that is understood across the organization. So I think this is to Chris's point, a nuanced conversation, but I really value the fact that we do return to these themes, and it may be, Chris, that because of the external environment that we're currently working in, where we're more constrained, we have to visit this topic more often, because we have to be responsive to it and keep it alive.
Absolutely. Okay, Chris, anything you wanted to say by way of concluding remarks, or?
Well, nothing. I'll continue the conversation on the next item, Simon. So.
Okay, thank you all. Thanks, Chris. So obviously we've received and discussed the corporate risk register, but we need to specifically approve the risk appetite statements and associated risk tolerances. People happy to do that? Thank you. Okay, we're still with you, Chris. Now moving on to the board assurance framework.
Thank you, Simon. Yeah, and again, we're just going to run through some slides quickly with this one, but I'm going to introduce it and then invite executive leads for each of the strategic mission areas to come in. And I think this does very much follow on from the last conversation. So we developed our board assurance framework report last year. That was the first time we'd done that. We've spent time over the last 6 months or so working very closely with exec leads and their teams across the organization to update the position moving into 2023-24. So just to recap, the Board Assurance Framework Report brings together in one place all the relevant information on the risks to our strategic missions. There's 5 strategic missions, and it provides board members with an update on controls assurances, as well as actions required to mitigate against the risks occurring and therefore give us a better chance of achieving our strategic objectives. I think Ivan's point I was going to comment on around controls. We've had a really good conversation around, you know, we don't want this tool to be used as something that we every year identify more and more controls for each of the principal risks and strategic missions. We want to make sure, A, we're aware of our risk appetite for each of the strategic missions, which the leads will take us through in a minute, but also be clear on what the actions are that will be taken to try and mitigate against those risks occurring, and what the environmental factors are happening around us that we need to be aware of to progress the strategic mission. So if we move to the next slide, which just summarizes our risk appetite position that we've just said. So we'll move straight through onto the principal risk summary on the next slide. And this is what we've spent a lot of time refining, tweaking. So board members will recall we've approved our integrated medium-term plan at the last board meeting, which had slightly tweaked strategic missions. As a result of that tweaking, we've tweaked the principal risks, and it is tweaking. It's not wholesale changes, but the exec leads have tweaked those to reflect the slightly refined strategic missions. And we've also reviewed the current risk score and the target risk score for each of the principal risks to achieving the 5 strategic missions. And then if we move on to the next slide, we'll see that generally what we're hoping to do through the plans that have been put in place and being led by each of the strategic mission owners, we're generally trying to reduce the likelihood of the risks occurring to give us a better chance of achieving the strategic mission. And then the next slide just gives a summary of our position. It includes our risk appetite position for each and our assurance rating, but I'm just going to hand over to each of the leads to talk through the next few slides. Before I do, I just want to mention one of the things we agreed with Audit Wales as part of the structured assessment feedback last year was that if there were any areas of concern or any areas where a deep dive would be helpful, we said through reviewing this report, we would identify those specific areas, because this is a broad report, and do a bit more deep dive through our committee structure. So if the discussions today identify any areas that would warrant that, that's how we will track those through on a more timely basis than we take this through to the board. So I'll hand over to Ivan, who's our strategic mission owner for mission 1.
Thank you very much, Chris. If we go on to the next slide, which is mission 1, we should put that on the screen. So there's an awful lot on each one of these slides, but it could be worse. It could be just a long catalogue of all of our strategies and documents and plans for everybody to sort of work through and extract the assurance that they're looking for. So I think it's a really, really useful document. I'm not going to go through every part. I also want to comment just on the, despite how much information is here, about how our various corporate documents tie very tightly together. So, you know, the missions as a framework are in the IMTP, they're in our business plan, they're in our performance report, they're in our board assurance framework, and there's a describable logic to, you know, how it is that we're applying risk appetite to different areas and the key controls that we have. I think that's quite an achievement, actually, and we've worked really hard on that, all of us as a board, over the last year or so. Just to mention on Chris's thing, DHCW is quite about controls. DHCW is quite a young organization. I think it made sense that that our posture was about finding gaps and plugging them for the first couple of years in the board assurance framework. But if that's what we do every year for the next 5 years, is look for gaps, plug them, and then look for new gaps and look for new gaps, the process will start driving a ridiculously over-complex, over-controlled environment. So at some point soon, I think we need to move from seeking key controls gaps to identifying key controls and optimizing those controls to make them as streamlined and as purposeful and as effective as we can. So I'm just going to go quickly through the slide here. We've got a cautious risk appetite. This is our platform for enabling digital information. This is our infrastructure. This is our data, our cyber. This is what everything is built on. So we have a cautious risk appetite. Stability, predictability, safety, security, resilience is what we're about here. So it's a cautious risk appetite. The RAG scoring overall is amber because we know we've got work to do in terms of shifting to open architecture, to common standards, moving off some of our legacy technology stacks. Element of shift to cloud is in this space as well. So we know we've got work to do, but it's not red. And it's not red because we do have stable systems. You'll see in the performance update later on, our uptime, the functionality that we've got through our own systems at the minute. So it's not green and it's not red. So it's amber, obviously, because that's the one that's left. I just want to pick out a few progress highlights. So that's the column the furthest on the right about some of the progress we've made over the last 12 months or so. Building of the new cloud-based data store, big procurement, lots of design, lots of assurance goes into that process. We're expecting to go live within the next few weeks on the Google Cloud Platform landing zone. Got an API delivery team stood up 2 or 3 months ago. We've put more detail in terms of deliverables into the IMTP. We're doing some quite pioneering work, I think, on the WASPI Code of Conduct. And as you all know, we've stepped forward a lot on cybersecurity in terms of a plan and various other things. For us looking ahead over the next half year before this comes back to you, it's cloud-based data store and APIs and documenting and structuring that, which is the big priority for us in that area, in this area. That speaks to controls. Documenting, specifying these things gives us the control documents that we need to then assure against. So that's what we're going to be focused on. Chris, I don't know whether you want to pause at the end of each mission for questions and comments or at the end of the 5. I think probably end of the 5. Yeah, great. So I'm now handing over, I believe, to Sam.
Thank you, Ivan. So this is mission 2, which is to deliver high quality technology, digital products and services. I won't read out the whole risk, but the risk that's associated with this effectively speaks to the ability of our stakeholders and customers to deliver effective, high quality care services to the public effectively. And if our services are not up to scratch, then their ability to do that is impacted. So overall status here is amber. Again, for similar reasons to Ivan described, we have got some gaps in this area which we've identified, but we do have mitigation strategies in place. We do also have a degree of stability across the services in this area. There are some significant delivery, or some fairly chunky pieces of delivery in this area, some of which have been discussed in this board previously. So obviously we've got the diagnostics portfolio with Link and RISP, we've got iCare, we've got WEDS, so some large high impact delivery programs in this area. The major action points that we've identified that we need to take forward are really around things like delivering the recommendations from the WCCIS strategic review, reviewing the outputs of the WED strategic review, reviewing the National iCare System Gateway review and making sure that we've confirmed the future arrangements for that, onboarding the Link program and understanding the basis on which we're taking that over and ensuring we can progress it safely. But this mission also encompasses some of the mitigations for the more systemic issues which we've talked about this morning around operating model and technical debt and target architecture and so on. So there are some specific pieces of work which we're kicking off in this quarter, which will include designing our product-centric target operating model. So we're bringing in a third party to work this on that. Doing a DevOps maturity assessment across the delivery teams and development teams to ensure that we're working to modern practices and identify a roadmap for improvement. I'm certain that there are significant improvement gains to be made, particularly around modernization of tool sets and so on. We're also looking at a cloud migration roadmap for WPAS, obviously one of our major flagship systems. So really keen to kind of tackle one of the difficult ones head on and try and understand what the approach would be to modernizing the architecture of that system and what might be reusable and can feed into the broader strategy. Thank you. And I'm going to hand back to Ivan for mission 3.
Thanks, Sam. So mission 3 is, we changed the naming of this quite a bit, expanding the digital healthcare record and the use of digital. And I'll just dwell on how it is different to mission 2. So mission 2 is all of our digital functionality, and mission 3 is where the functionality and the platform presents to users. You know, it doesn't matter how good our platform is, doesn't matter how good our digital functionality and our applications and services are. If users don't use them, then they don't do anything. They don't add value. And almost all of our systems are in the clinical space. So the single digital health and care record is the key thing, right? Because clinicians need information. We don't want to throw all of the data at them. They need information. So this mission is very much focused on that and on that interaction with users, which is why it's framed in the way that it is. So even though the single health and care record contains data, we've got a moderate risk appetite here because we want to be iterating. We want to be trying out new ways of presenting information to people. We want to be reassuring ourselves that clinicians are getting the information that they need, with a lot of dialogue with clinicians about the information that they want presented in the ways that they want it presented, and so on. And that really is the strong emphasis here. And we can go a little bit faster there because and I just want to sort of, I know I'm going on about it a little bit, but it's not the same as data. So information is different. It's different to data, and we need to respond as quickly as we're sensibly able to what our users are telling us that they need. So again, it's an amber current score because, you know, we are providing lots and lots of systems that they use, and we've got, I think, relative to other health systems across the UK, quite comprehensive single digital health and care record, and we've had a shared care record as described for ICSs for several years, where primary and secondary care information can be brought together and presented, as well as national coverage on LIMS and referrals and test results and so on. So we shouldn't be too hard on ourselves, but we've still got a way to go to achieve our ambitions. Progress over the last year. There's been good progress on Welsh Nursing Care Record, multiple award-winning program, fantastic clinical engagement, and is effectively doubling down on the success in the adult inpatient environment to now roll into a paediatrics children's inpatient environment, and that's a program that's just kicked off. And the NHS Wales app is in public beta launch, so it was launched on app stores at the beginning of April. We've got a managed incremental growth on that, which will accelerate within a few months, new functionality coming onto that platform, and we'll be onboarding primary care providers, and things will speed up later on in the year. But again, you know, we've got a managed and sensible approach to what we're doing there. The final thing I want to comment is I'm the executive lead for this mission, but you know, it cuts across everybody's areas, and we've got different. There's a strong contribution from everyone. So clearly, you know, Viridian as the medical director is taking a strong lead on clinical engagement, clinical input, clinical design, and so on. Sam Hall is our executive lead for or board lead for user research and for user design in the round. Sam Lloyd and I both strongly contributing to that. The benefits realization framework is led from Claire's area because of the link between finance and the importance of that discussion, which, you know, we touched on in terms of technical debt. And then the NHS Wales app sits, you know, more clearly with me. But all of these missions are, you know, they're for all of us, even though we've got exec leads on individual missions in the BAF. And I'm handing over to Viridian.
Thank you, Ivan. So I lead mission 4, so that's termed drive better value and outcomes through innovation. The principal risk is described there. Our risk appetite here is open. This means that we'll take more risks to achieve this strategic mission compared to the other missions that are in our portfolio. The RAG score going into 23-24, and considering that the last couple of months is now amber. This doesn't really reflect a significant concern, more the fact that we've recently established the R&I function, and so within the organisation we're still putting those building blocks in place, and therefore our focus will now be on embedding the approved governance associated with the R&I strategy. We are reviewing our formal academic research partnerships, and we will continue at pace with the development of the Digital Healthcare Wales information strategy, and we will see that in a subsequent board meeting. The key controls, action plans, etc., and progress on those action plans have been updated and are visible there. And Chair, I'd like to record my thanks to members of the DG&S committee for their input and oversight and help with the R&I agenda to date. So that's my summary. I'll then hand over to Helen.
Thanks, Rydian. And for the purposes of today, I'm Claire, who's on her bike somewhere in heading to Pisa in Italy, I think. So the working group that Claire heads up in terms of overseeing the mission 5 of the BAF is kind of describing this as a moderate in terms of risk appetite, and it kind of is mission 5, as you'll know, is kind of a catch-all, if you like, for the stuff that we need to do as an organisation to achieve being kind of a highly inclusive, ambitious organisation that is the trusted strategic partner. So it's got quite a lot in its remit, really, in terms of how we need to organise ourselves to deliver. And the moderate will reflect that some of the things that come under mission 5 will be open in terms of its risk appetite, things like talent management and engagement, and other things will be more cautious, like our approach to financial management. The RAG score is amber. Colleagues may remember that this was green the last time that Claire reported this. The amber kind of reflects that we're at the start of the year now for this, and there's much of the workforce, finance and quality plans are just kicking in, and given where we are, the current financial situation, that feels about right in terms of kind of the where we are in terms of delivery of that. So areas to pick up on. When the digital workforce review is published by Welsh Government, we will take forward the action plan. Work has already started in the digital professionals group. That met for the first time this week, actually, and that's chaired by Sarah Jane in her capacity as the Director of People for us. That really is looking at the longer term, broader digital informatics workforce that we need across the NHS in Wales. So we'll see quite a lot of focus on that this year going forward. And of course, a lot of focus on the sustainable funding model, and a lot of work and conversations and discussions have happened on that, as has been reported, and colleagues will have been involved in, but also a lot to work through for us as an organisation, and with colleagues in Welsh Government going forward this year in terms of setting us on that sustainable financial footing. And another one to probably pull out in terms of a highlight is the development of the action plan to embed the 6 pledges, the Digital Inclusion Charter that Simon and I signed up to on our behalf in the summit that we had in September. I've put myself forward as the exec lead for digital inclusion so that we can really champion that for the board and for the wider organisation. So really excited, and hopefully I think we're going to share some of that at the next board meeting in terms of where we're getting to with the action plan. So there are a number of plans being implemented across all of the areas. But still a lot to do, and as you will kind of hear now from Mark in the finance paper, which I think we've kind of we've preluded a lot really through the discussions this morning. There's quite a lot we need to do in terms of the savings that we need to make, and where we are in terms of making the savings that we need to financially, and balancing that with actually filling the vacancies, the priority vacancies that we need to deliver the stuff that is in the plan. So it is a fine balance for us as an organisation. So there's quite a lot for us to manage, and quite a lot for this process of the board assurance framework to manage. And of course, there'll be ongoing scrutiny for the sustainable financial model and workforce plans through the audit and assurance committee going forward. But happy to take any questions along with colleagues.
Matt, Chris, you didn't want, before ask a question, you don't want to come back in. Okay, Marion.
Thank you, Chair. I was just really going to jump in at the end of Helen's comments, and on behalf of Audit and Assurance, we will of course be overseeing many aspects of Strategic Mission 5, and it's probably worth drawing the board's attention to the good engagement, I think it's fair to say, we've had on the implications of the duty of quality, for example, and we will be continuing to monitor that aspect. and keen clearly to oversee the financial position and the strategic workforce plans we've heard so much about this morning already. Particularly pleased to hear Helen's reference, and of course the focus we had earlier today on digital inclusion. And maybe that's just one example of something we might request as a committee, a bit of an update or a deep dive in future. And it's good to hear now that Helen's taking the executive lead on that particular aspect. But I'd also add how pleasing it is to see the board assurance framework maturing over the last 12 months. And I'd just like to take this opportunity to thank Chris and his wider team for what I think we'd all agree is an excellent piece of work, which we've seen today. Diolch yn fawr.
Thank you, Marion. I'll take all the contributions, Chris, and then perhaps ask you to come back in or bring other people back in if they want any response. David and then Rowan.
Thanks, Simon. So I wanted to build on Marion's point really about the board assurance framework. I think this is now becoming a really valuable tool for us as a board to see what's going on with our strategic mission. So compliments to Chris and the executive team for the work they've done on that. And again, the point that Marion made about the inclusion of digital inclusion in one of our strategic mission, again, it's us acting upon the things that we've said in public and building them into our everyday plans. So again, commendment from me on that. I did have one question, which is probably going to go to Ridian, which was really keen to see the analytics strategy on there, because that's something I take close interest in. I just wondered if Ridian, when we get to responses, can give me some idea of a timeline for that.
Okay, let's take Rowan's question, comment, and then we'll come back straight to you, Ridian.
Thank you, Simon. I'm looking at this document. I think we all are as a really good tool for prioritizing some of the choices we're going to have to make. Clearly, there isn't enough resources, money available in the system to do everything now, which comes hard to somebody who's got no middle name. So patience isn't it. But I'm really struck by Mission 4 as something that driving better values and outcomes through innovation, certainly driving better outcomes and trying to reduce costs is something that's around the table of every board room in every health system that I'm aware of right now. And I'm also struck by the fact that there's so much going on here that the execs have got an awful lot to think about. And I'm just asking the question really is can we as the full board find more ways of creating time to think together so that we build that sort of shared understanding of how we prioritize through this board assurance framework, because I think there's a lot of value here and we could unlock it in the next few meetings. So just interested to hear other people's thoughts on that really.
Ridian, did you want to come back first, and then Chris, you come back on Rowan's suggestion?
Yeah. Okay. David, I think I got a bit of that. I think what I heard was analytics.
You're on mute, David.
You're on mute.
David, you're on mute.
Yeah, sorry. It's one of the actions, Ridian, is developing the analytics strategy. So I was just wondering when we might see that.
Yeah, so a combination of things is obviously data collection, data mashing, for want of a better word, and then exposing that information in a way that it can be consumed by those users who would gain most benefit from it. I think a good example perhaps is to point you towards the health intelligence link on our website. There are a number of published information dashboards available to the general public, then those available to within the NHS. And actually, this week I've been having discussions about putting our beta prototypes in that link as well, so that we can see all the things that are being developed. previously we've seen some analytics, haven't we, on electronic test requesting, Welsh patient referral system, but really we need to expose that data in a way that people can get to it. Rachel, as you know, leads this area within my division with my department and is very keen to do that. And we've got some great people, including Martin Williams, in that Power BI space. Ultimately, it goes to content collection, validating that data through the process of care delivery, and then having validated that data, expose it in a way that it doesn't break any rules and that provides information to the service that they can learn. So I look forward to giving you updates as they come. David, I haven't got any definitive timelines at present that I could give you a date that it'll be completed by. I think there is a bit of a continuity process here as we look at various new things that come over the horizon. A good example would be the 5 new HQIP cancer audits data sets that are coming out of Welsh Government. We're constantly hit by things that we have to go looking for the data. And you know, that's why I don't really put a timeline on it. What we do need, David, and you and I are in agreement, is a process for people within the service to ask for stuff, and a process where those asks can be validated as indeed worthwhile doing, a cost associated with it, so assessing what it will take for us to do it, and then delivering it.
Thank you, Ridian. Kristen, do you want to pick up on Rowan's point around finding time for further discussion on some of these, the key risks?
Yeah, so welcome Rowan's comments. I'm really grateful to the board for their engagement in this. I'm really keen. I've got the board development forward work plan discussed with Helen, bringing it to execs for a run through soon, and really keen to link in with Ivan and others on our long-term strategy, which is taking up a fair bit of board development time coming up, because I think this could link into that. So I just want to make sure the prioritization, our organizational purpose and our long-term strategy, along with Deloitte's, links together, and we make sure we've got good board time. And just to comment on David's point, the information strategy, it is part of the forward work plan, David, and it is on the DGNS schedule to come forward, so you will receive updates through that committee on that.
Thank you, Chris. If no one has any other questions or comments, and thank you all who contributed to that. We've been asked to approve the board assurance framework. I'm sure report. I'm sure people are happy to do that. Thank you. If we move on then to item 6.3, the integrated organizational performance report. And I'll ask Ivan Evans to introduce this item to kick us off, Ivan.
Thank you very much, Chair. I would like to present this report and bring it to your attention, but firstly note that it's also for discussion, and hopefully we can have a little bit of a discussion around it, as we've had on a number of the items that we've just been through. And as we've discussed in our board development session recently, there are a number of things in the cover report to draw to your attention, but there's nothing to raise formally to the board in terms of formal escalation today. So there's an opportunity for us to have a discussion on what's included, and I will invite other members of the executive in to comment on certain aspects in a moment. The format of the performance report changes from one meeting to the next. Alternately, we will be presenting a report which looks at our organisational performance, and then one which also looks in the next session, which looks at our performance against the IMTP. Every other. So working with the leadership group in the organisation, we've started to talk about 4 kinds of performance, and I'm just going to take a moment to talk about those. And I will be, we've been having those discussions in English, so I will be presenting them in Welsh here, but also referring to them in English. So the first of the 4 is organisational performance. So how we operate as a statutory public organisation, how our corporate systems work, and also how our ongoing business and core services that we have operate. And you will see that in the report today in the second half. The second then is our delivery performance. Are we delivering the plan that we've put in place for ourselves? Are we delivering against the IMTP that we've published? And our emphasis has been on those two things, and that's what's in today's report. We want to increase our emphasis, or how much attention we pay, to two other aspects, namely, firstly, efficiency, productivity and efficiency performance. Are we getting better at doing our work? Are we able to have further delivery out of the scarce resources that we have, people and financial? How well or how effective and how productive are we? And then finally, the fourth is value performance. So that is, we can be very good at doing things and delivering very many things, but does that deliver value to the health system in general? Does that improve health outputs and outcomes for people? And does it genuinely make a difference across the health system? So those are the four aspects of performance. And the report today looks predominantly and specifically at the first two. We have to go through them in order. If you haven't got organizational performance, then you're not able to deliver those that are most ambitious. So the first half of the report that you have, it's about 40 pages in the report. The first half looks at our delivery performance against the IMTP for last year. So the IMTP for 22-23. And there is a plan, one page plan on a page, which shows almost everything in green, apart from two deliveries. And the red does not mean that the program, and we have discussed this before, red doesn't mean that the program has a red rag rating. It just means that that one thing, that milestone, has not been delivered. And then there's a level of detail following on each of those through the 20 subsequent pages. They use the mission and portfolio titles from last year's IMTP, so that they've changed a little bit, but last year's are in the first half of the report. And then at the end of the first half here, there are two pages, one looking at financial performance and one looking at our principal services that we deliver. Mark will talk in the next item about finance. And then in terms, also Sam will be talking about service performance this year, and I'll just draw your attention to the fact that there were 45 incidents during the past 12 months up to March, and that the availability of our services overall across all services was at 99.977% in terms of availability of services. Moving on then to the second half of the report, and this is where I'll bring other individuals in to contribute. The second half of the document that you have in front of you today looks at our organisational performance, and there are a number of specific issues that we draw to your attention in the cover report. The cover report has changed a little bit compared to previous ones. There is a greater level of detail in it, and also we are trying to say a little bit more of a story as to what has happened over the recent period, with a little bit more. And also we draw out some of the main things. One of the things I want to note is that there's a mistake in the first word, unfortunately. So the first word where it says May was a difficult month, actually it meant April was a difficult month, and hopefully May will not be. So apologies for that. We will rectify that. Then in terms of the principal elements, you'll see in the report that we want, and I want to invite some of the other directors in. So with those words, if I could please invite Ridian to come in just to say a word about the incident that we've had with EMPI, please, at the beginning of April, and we'll go on.
Thank you, Evan. So EMPI is the Enterprise Master Patient Index, and it's a source of demographics which is used across the majority of the national services that we deliver. And there was a reported incident 2 o'clock on Thursday, the 30th of March, and that lasted until 10:30 the following day. What happened was an overwrite of some of the elements of the demographic, particularly probabilistic matching of records relating to data items within the demographic fields. It affected just over 1,400 individual electronic patient records, and Welsh Government were notified, and the health boards were notified, and we had an executive board, an executive emergency meeting rather, with chief executive directors of digital and medical directors, most of whom are the Caldicot Guardians across Wales. We've put in mitigations to correct the identified problem, which prevented any more happening. We then provided the lists for health boards on the patient record identifiers that we thought were affected. All the health boards, except one now, have completed their harm reviews associated with this. This harm review is a standard procedure done when there's something like this happens. No harm has been identified at this point in time. Digital Healthcare Wales have completed their technical element of the programme resolution and have started the root cause analysis. Root cause analysis will obviously be shared once completed, and as a sort of belt and braces approach, the team have gone back and checked again all the downstream systems, and that will be part of the sign-off before fully closing the incident. So on the surface, this may sound alarming. For those who don't work in delivery of care, demographic corruption, incomplete data, errors is rife within the paper world, I'm afraid. Things get filed in the wrong notes all the time. Clinicians are trained in a certain way to look at information. I won't bore you too much, but part of your medical school and postgraduate training is, this is the record of, and then you look at the heading and you look at the records, you compare it to the patient in the same way that you'll be aware that we have safety processes. When we give medicines, we identify the individual, we identify the drug chart, we identify the drugs. So the medical fraternity were less concerned regarding the overall risk of this compared to the digital community. It's unfortunate. It's been technically resolved. We will deliver a root cause analysis, and no harm has been identified to this point in time. I believe we're waiting for in the region of 200 to 220 records to be reviewed. So when you consider how much care is provided across Wales, this is an incredibly small number.
Thank you, Rydian. I think if we have any questions or comments, that I propose to take them at the end after everybody's presented, if that's okay. Okay, thanks very much. I can see people agreeing with that on the screen. So moving on then to the second thing that we are drawing to attention, which are the service level agreements and our relationship with other health boards we deliver services for. That's going to be part of Mark Cox's report, the next item. So rather than calling him in now, we'll pause for that, I would propose. And I just want to talk briefly then about the commercial team. I have referred to this already in the report that Michelle presented on strategic procurement. Members of the board will know how intense and how complex several items of the commercial work have been over the past 8 weeks, and it continues, of course. So I just want to praise the team, a small but very specialist expert team that's been carrying a considerable amount of this stress and pressure and complexity through March and April and into May. But I'm not going to call myself in or say any more about that. And I would also just like to briefly talk next about people and invite SJ in to talk about the performance assessments and where we're at on that, and maybe something about the staff conference. I know that Helen's already referred to that already. SJ.
Hello, yes. Just to say, I mean, we have touched on this already this morning in terms of the staff conference. We had a really large number of people that tuned in, and also I think, as Helen said earlier, it's been recorded, so people have actually dipped into that at a later point, probably because of work pressures and other things. They couldn't all attend at the same time, but it's been a really good opportunity to test the pulse of the organisation, and we've had some really good feedback, and we're going through some diagnostic at the moment about, as Chris said earlier, how we're going to pull together next year's, what we've learned through this year's and the years before, to make sure that we're trying to get everything covered off. It's been a really positive way of doing it, and next year we're looking at potentially looking at that in a more hybrid way. So perhaps having some executives at different hubs, doing some of it online, doing some of that in situ in different offices across our estate. So yeah, lots to go after, but we've definitely learned a lot this year, and we've had some really good feedback, and it's been a really good opportunity. So I think everyone felt that there was something for them, which was great, and very much celebrated in that regard. Really, lot of work goes into it. So I think a big thank you to the comms team and to the people in OD team and everyone that contributed and was part of that. I think it was a really positive event. Lots of reflections, some keynote speakers as well, external. Chris Moon in particular was one I introduced, and I think that went down really positively, and that was great that we managed to get him to attend and come along for us. But yeah, really some really good things there, and would welcome the board at some point in the future, and we've got a long way to go to look at next year's, to contribute into some ideas for that for next year. So that's something, so a bit of homework for all of us in the next sort of 6 months or so.
SJ, thanks very much. And then finally, and we've already touched on this, that April was unusual in terms of the number of major incidents that we faced in IT service delivery. So I just want to invite Sam Lloyd in to say a word about that, Sam.
Thanks, Ivan. As you say, April was an unusually high month. So we had 9 incidents in April and 3 in March, so 12 in the period since the previous board, which is, I think, probably the highest incident rate that we've had in the last 12 months. It's too soon to say whether this is an anomaly or whether it's part of a trend, but we're certainly going to be looking at that closely. The breakdown of the incidents that we've had this month falls into, so we had 5 on WRIS, we've had 3 on WPAS, and then we've had 1 on WCCG, MPI, WLIMS, and WCP respectively. So the 5 RIS ones and the 3 WPAS ones are obviously focuses of attention to see whether there's linkages there or there's any sort of themes that need to be pulled together, and we're looking at that. We've got open problem records on those. Early indications are that there probably aren't. Those systems are locally hosted, so they're dispersed across the health board, so it's not necessarily that easy to find a common link between them, but we'll certainly be looking for one. As Ridian said, the EMPI incident has really been the big one for the month, and whilst there's been no impact to patient care, there has been a lot of time and effort that's been spent in recovering that situation. It's taken a lot of time on behalf of the teams across operations and elsewhere to resolve it. So that's obviously had a knock-on impact on other work, which we're now working to mitigate and understand the impact on IMTP milestones and so on. So that has been a significant undertaking for us to resolve that. All of that said, though, it is worth noting that our overall availability remains fairly high. So we're still at 99.98 for the month of April, which is only slightly below the 99.99 that we had for the entirety of the year. So we're not doing too badly in that regard. And just for information, we are looking at whether there are ways that we can report availability in a more meaningful way, because it's probably appropriate to have different availability targets for different parts of the infrastructure. So we would expect core underpinning hosting capabilities to be very highly available, whereas other aspects perhaps don't have the same requirements. So we're looking at that, and hopefully we'll be able to update the report in the future. Thank you.
Good, thanks very much. Just to conclude then, reporting on performance is part of my responsibilities in the strategic arena. You will have seen how the performance report has evolved over the last 12 months. We try to make it a useful tool and a tool which communicates transparently and which permits public discussion here at the board, and also we use it internally as part of our management and control work. So I'd like to thank our teams across the DHCW who contribute towards this. I'm not sure what the Welsh word for iceberg is, but you're actually seeing the tip of the iceberg here. But there is a considerable amount of work that goes on an ongoing basis from month to month to prepare this report. But there's always room for improvement, as you know. So I welcome a discussion and any comment or questions you'd like to put, and thanks very much to the directors also who've contributed in these sections. Thank you. Simon, back.
Thank you, Ivan. Thank you, everyone. Rydian.
Thank you, Chair. I just want to comment on the WPAS downtime. So I was actually delivering clinic, and at the time that it happened, so I had a direct impact. So there were two things. One is they turned it around in terms of the data center, the backup, incredibly quickly. So the interruption was minimal. And the second thing is that we provide an all Wales view via WCP of the clinical record, which is a read view and not linked to the PAS. So despite a PAS being down at the local level, we thought about this before, and providing a read view to the notes allows the work to continue. So I just thought I'd make that note. Finally, I'd just like to thank the teams that are in these dark rooms with the backups and doing all the work, because without them, we would really struggle on the front line.
Thank you, Rydian. Marion.
Thank you, Chair. And can I say thank you to Ivan for his very clear presentation. And I'm sure we all appreciate how this performance report has evolved. And I find it extremely useful and very clear and transparent as well. A couple of questions on various aspects. And maybe Helen earlier partially answered this, but I haven't quite grasped her comment. The SLAs with the health boards, while it's a good thing at the point that this report was being prepared, that 14 of the 22 had held their meetings and signed SLAs, I take it. It would be good to have a definition of what the situation is by now, please, because clearly there's a deadline of the end of the month. So that's my first question. Where are we at with those meetings and signing the SLAs within the timetable up to the end of the month? Secondly, in terms of information governance strategy, clearly there is work that's been ongoing on this, and the expectation is that it will be completed by the end of Q1. We've also heard about the workload issue, the major workload issue on the SLT's shoulders. And I just want to ask really if we're likely to see that coming to the fore and being completed within the appropriate timeline. And thirdly, from me, a comment on the appraisals. A bit disappointed to see that graph was dropping once again. But interestingly, looking back 12 months, of course, this is manifesting and showing a trend, isn't it? When the start of the new financial year begins, then performance appears to slip a bit and then improves as the financial year goes on. And clearly, the suggestion has been that there has been action put in place to make sure that performance can improve. So just really want some assurance in a way on that point, that there is an appropriate focus on the appraisals. Thank you.
Okay.
Let's start that off with responding.
Sorry, Simon.
Go on, Ivan.
Okay, thank you. On the appraisals, perhaps SJ would like to come in, but certainly from my point of view, we've discussed it in our senior management team, and we've discussed it recently as an executive team. In certain areas, there is an impact because of new teams that have come in, that have just come forward, as in the diagnostics area, for example, where having taken on the teams, then we're looking at how we can restructure them. So it's difficult to undertake appraisals and put performance plans in place for the year when there is a process of change ongoing. So that's the case in certain areas. I think also that there is the end of year impact, because the beginning of the year is the time that means that there's a lot of things that were done 12 years ago just come to a conclusion, and we're seeing a little bit of a dip during the month. So we are aiming our work towards those. Then in terms of information management and governance, maybe Rydian would like to come in to talk a little bit about that. and information governance, and I can see that Mark's hand is up, even though I'm sure there will be an update on the SLAs in his finance report following this.
Okay, let's take that in order then. So SJ, do you wanted to come in on the appraisals issue? Yes.
Yes, please. Yeah, no, Ivan said what I was going to say, really. We've inherited some teams, so they're a little bit behind the curve and they're on catch up. Just to provide reassurance, there is plans around everything. So we do weekly catch-ups more informally across the directorates and my team, and then on a monthly basis at a more formal directorate-led meeting. So they are worked through in quite a lot of detail. So there are plans around those. Some of them are because of specific situations, and others it's the beginning of the year, as Ivan said. So I just wanted to provide a little bit of assurance that we always see a little bit of a dip, that things will improve, and we always make sure that we're on target, and that people have got their objectives in place, they've got their performance supported, because actually in terms of our succession planning, our talent management, and all of the other things that we're doing in terms of development and support for the workforce is all integral within the appraisals. So if people haven't had appraisals, we often say, go and speak to your manager, make sure you put the time aside to put them in and get those throughput. So just wanted to offer a little bit of assurance in that space that it is really high on our agenda.
Thank you, SJ. Mark.
Yes, I'm happy to pick up this here, actually, Marion, in terms of providing the sort of progress that's been made over the recent weeks on the SLA approval front with organisations. I know this this particular report captures the formal SLA review meetings in terms of the KPI performance and going through major incidents as part of the account management approach. But there's been significant meetings as well to discuss the financial issues to get the approvals for the SLAs. We've made considerable progress, I'd say, and that's reflected in the score in terms of the risk register. However, we do have one organisation which we are engaging with to get to a final position.
Thank you, Mark. Was there a third element in your questions, Marion? I can't remember. No, that was it. That's covered off what you asked, is it? Yes.
It was the information governance strategy.
Ah, yes. I thought that was. Go on, Rydian.
Thanks. So this was discussed recently at a clinical directorate review with the executive body. The information governance programme essentially has 4 streams. We've talked about one earlier, the Welsh Accord of sharing of personal information. So that's progressing. The NIAS procurement procurement. So that's the essentially the audit access to the electronic medical record. I can hear Simon. And the third element is the toolkits, the IG toolkits, and those some are completed, some are to finish. And the third bit is the data promise, or what that will be called. I'm a little bit uncertain at the moment. But of course, that has a dependency. That dependency is on policy, and I'll leave it at that for the moment. And also the funding element for those work streams. Some are within the organisation, and some are outside the organisation. I've had some very recent success in negotiations with some of the key stakeholders relating to patient data. I'm very keen to see discussion about data controller, joint data controller, and how we could facilitate that. And I anticipate that I will have some good news by the next board in some elements relating to that, and I'd be happy to update if asked.
We wait with bated breath, Rydian. Alistair, you've got your hand up, and then we better move on.
Thanks, Simon. And it's really just to add, really congratulations to Ivan and the team for producing such a packed set of slides and information. It really is full of information, and I find it really helpful. So I'm very grateful for that. I got a really good handle on what you're doing. I'd be grateful if you'd be able to pass that back to your colleagues, Ivan. Also to notice that there is increasing use of terminology around the public and not just patients, which is, I think it's right, and I think it's appropriate, and it's great to see that. And there's also, I think, a lot more definition now around the care part of DHCW in a whole variety of areas right across the board. And I think that's really helpful because, you know, some time ago we were debating really what the care side of DHCW specifies, and I think that's becoming that's manifesting itself really clearly. Just a question around engagement and partnerships. I realize this is only April, June, and it's a snapshot. It would be great to see that discussion expanding where appropriate with other parts of the public sector that we've talked about before. You know, local authorities in terms of social care and the health and care in the community, where that's appropriate. It's something which it always leaves me wondering. It could we appropriately be doing more there? But I realize this is a snapshot in one period of time. But really, overall, just to say thanks very much indeed, Ivan.
Right. Thank you.
Can I come back in quickly, Simon?
Helen wants to come.
So firstly, certainly, thanks. Thank you very much. I will pass those thanks on to the team, and I'm really grateful actually to you for drawing attention to how the public and care are becoming more and more apparent. I'm so close to the document that perhaps I can't see that, so it's really encouraging to see that that is coming to the fore. In terms of the engagement, we've been thinking carefully in some of our programs how we can bring the public in. It's difficult to go around all local authorities and all patient groups and all small groups. So we've been thinking, for example, with the app, the DFPP program, how we can do something which is an open platform where we are able to invite a number of our stakeholders, widespread stakeholders in to discuss with us, and perhaps even use examples of what we've done for our own staff, because the presentations, we do 10 talks, which are at 10 o'clock in the morning, and we do 6 and 60. So 6 10-minute slots on one of our strategic themes. So how can we perhaps do that in a more public way? So we are thinking about it. Don't have any solutions yet, but we will be bringing an update in due course.
Thank you, Ivan. Helen, briefly.
Just picking up on Alice's point around the engagement, really. So in the performance report, the engagement that's measured are the SLA meetings and the exec to exec discussions that we have with other NHS organisations. There is an awful lot of engagement that goes on beyond that across the organisation, I guess, just to reassure you. And in terms of the engagement out to other areas of the health and care sector then, and particularly with social care staff, I would say. I mean, we meet regularly, I meet regularly with colleagues in Social Care Wales, and of course the WCCIS programme. And there's quite a lot of work that, and it's not just about the programme, there's a lot about the information development is going on in within the WCCIS programme in Sam's area. Sam's doing an awful lot of engagement kind of in that kind of community services area. So I think, yeah, we could perhaps provide a bit more information on that stuff as we go forward, really. We'll have a think about that, Alistair.
Lovely, thank you, Helen. Thanks, Ivan and team put together the report, and thanks everyone who's contributed to the discussion on the performance report. Okay, we're asked to receive that report, and I'm sure everyone's happy to do that formally. Right, moving on quickly to the finance report, and as mentioned earlier, Mark Cox, the Associate Director of Finances, deputising for Claire, who's absent today. Mark, over to you.
Thank you, Chair, and afternoon, everyone. We do have a set of slides to run through. These slides really reflect the activity that's been underway within the finance team, looking at past, present, and indeed future financial considerations. So we are looking at the end of year accounts and finalising the financial performance for last financial year. We're also looking at the present in terms of managing the financial position for this financial year, and indeed the future as regards the financial sustainability agenda. And as we rise out of the SLA agreement process, what kind of lessons we can learn. Before I go into the slide pack, I'd like to just reiterate where we are and where we find ourselves as a system, just to give context regarding some of the pressures across the organisations and indeed DHCW. We find ourselves £633 million in deficit in terms of the IMTPs that have been returned by all organisations. As you can imagine, the impact on DHCW has been some difficult discussions around the SLAs as organisations have been requested and required to make choices and challenging savings initiatives. From a DHCW perspective, as Helen mentioned, the IMTP identified an unbalanced position amounting to 1.9 million for this financial year. As a consequence of that, certain actions were taken and certain formal submissions were required. DHCW internally, there was a deep dive at the audit committee to describe the pressures that were emerging that drove the overspend position, the forecast overspend position, and indeed to describe opportunities that we could look to investigate in order to manage it throughout the financial year. In terms of the accountable officer letter that needed to be submitted to Welsh Government, Helen mentioned earlier on that a detailed letter was issued, and that letter described the pressures that were emerging for DHCW, and it articulated it in three main ways. The first is the underlying position, which reflected the historical funding issues that drove some of the services in terms of the deficits acquired as a result of growth and indeed additional service requirements in existing services. There was emerging issues and pressures, not least of which being energy, digital cost pressures, indexation, and supporting the cyber agenda and data migration activities for this financial year. Lastly, the new services, and these reflect services which have transitioned from Digital Priority Investment Fund initiatives into live services, which needed to be supported via sustainable funding through the SLA process. So those particular issues were identified and presented to Welsh Government as part of our response to the IMTP submission, and the fact that we forecast we would not have a break-even position at the end. Helen also mentions that there would be a requirement from all organisations presenting a deficit position to make choices and provide savings initiatives in order to bridge the gap for this financial year. An exercise to that end was undertaken by the executive board within DHCW, which considered proposals brigaded by the confidence in terms of delivery and also the impact on the IMTP. A number of these initiatives were identified and taken forward, and they'll form part of the revised savings plan, which is identified within the pack, and I'll touch upon that later. So we can just start the slides. So in terms of the presentation, I'll be looking at the past in terms of 22-23 and where we ended the financial year and the considerations regarding meeting the timelines for the final accounts. In terms of this year, we'll be looking at the performance for April, very early on in the financial year, but it will be a key indicator going forward. The revenue performance in terms of the trend and the savings. We'll also be looking at COVID and the DPIF priority position. We'll be looking at the capital plan, and lastly, reflecting on risks and opportunities and what we'll seek to do to mitigate those risks. Next slide, please. As is usual, we brigade the performance reporting within our financial reports in relation to the funding streams. The first is in relation to core services. The second and third are in relation to our non-recurrent funding streams regarding COVID and the Digital Priority Investment Fund. Next slide, please. So in terms of last financial year and the 22-23 outturn position, we met all our financial targets for the year. We remained within our revenue resource limits and reported a very small underspend of 72k. In terms of capital, there was a small underspend reported of 88k. We met our public sector payment policy, and that reflects how quickly we've settled our debts, and we have a target of 95% in terms of meeting our creditors within 30 days of receipt. We've exceeded that by 3%. In terms of cash balances, we have a notional target issued by Welsh Government to have a ceiling of £2 million in terms of our cash balances at year end. That could be a very tricky exercise to undertake given the number of invoices that need to be settled prior to year end, but we managed to hit that target at 1.2 million. Just for note, in terms of the run rate in March, in terms of pay, it increased significantly as a result of the notional requirements in terms of the increased pension liability for organisations. Just to provide some context, in 2019, there was a valuation carried out in terms of the benefit requirement for the pensions, and it was identified that there was a gap of some 6.3%. That is being managed centrally by Welsh Government. However, there is a requirement that each organisation reflects that within its books, and at the end of the financial year, there is a notional transition of the 6.3% increase of cost, and that amounted to 2.4 million, and that is reflected in the March run rate. Next slide, please. In terms of the financial accounts, we submitted the draft set of accounts to Welsh Government. We also provided a briefing to the board to give them sight of the draft and to enable them to acquaint themselves with the structure and some of the content, so that when they finally received the final accounts, they would be in a good position and to provide an informed decision as to approve the accounts. We also presented to the Audit and Assurance Committee prior to the submission. In terms of timelines, we'll be looking to produce the set of accounts to be approved by the 27th and be ready for the Welsh Government submission on the 31st of July. We have been in discussion with Audit Wales, and all indications point to that we will be able to complete the audit well ahead of that timescale. It's worth noting the new auditing standard ISA 315 is in operation. There's been a substantial amount of work, it must be said, arising from this, and we do expect again that will be resolved, and that will be, in fact, not impact the deadlines that have been set. Next slide, please. So picking up on April's performance very early on, we do have an underlying run rate in terms of the £1.9 million deficit that has been articulated of 154k overspend for the period. Our actual overspend was just 38k, providing a positive balance for the month. The capital plan is on target. There's limited spend been planned in for the first quarter of the financial year, but the expectation is that this will increase throughout the year. In terms of the public sector payment policy, we have overachieved the 95% target, and we've hit actually 99%. And in terms of our cash balance, we have increased our cash balances, and we will seek to do so over the next 2 to 3 months in order to settle a substantial Microsoft invoice due in July. Next slide, please. In terms of the run rate is materially affected by DPIF profiles throughout the year. As part of the improvement process for this financial year, we frequently engage with the DPIF leads in order to provide a smooth profile going forward. For this month, we've spent just over £12 million. It's a slight decrease in terms of core spend, which is played out as part of the underspend position as against the expected 154k overspend. Next slide, please. The savings plan. This slide presents not only the savings plan that was part of the IMTP, but the revised savings plan, which incorporates the executive management decisions regarding the proposals to break even for this financial year. You can see from this particular slide that there are a number of initiatives we haven't started as of yet, and that's fundamentally because they were only agreed over the last few weeks. We will be presenting this as part of the response to the Accountable Officer letter, which is due to be submitted at the end of the month. What you will be able to see from the particular movement in the savings plan is the proportion of recurrent savings and the proportion of non-recurrent savings, and I'll be happy to take questions on the makeup of that after I finish this presentation. Next slide. The next slide is representative of the COVID expenditure run rate for this financial year. In terms of test, trace and protect, there's an expectation that there will be a scaling down of the service requirement this year, and we will be looking to revise the licensing requirement going forward. So we may see a significant reduction post June and July once that agreement has been made with the Microsoft supplier. In terms of the vaccines run rate, the actual variation reflects the movement in the boosters in terms of the autumn booster campaigns, and is mirrored on last year's activity. Again, that will be influenced by Welsh Government and Health Board's future plans. Next slide, please. In terms of Digital Priority Investment Fund, we are expecting £38 million worth of revenue funding for this financial year. A considerable amount of those schemes have profiled expenditure later on in the financial year. We are still to receive confirmation of funding of a number of schemes amounting to £10 million. As you can see, they are highlighted there. The National Data Resource, the Data Centre Migration and the Cybersecurity Investment Plan, and we're due to have confirmation of funding within the next month. Also for consideration is the transition of the iCare digitalisation programme, whose financial impact will be reflected within future performance reports. Helen has mentioned that there's been a gateway review and there's a lot of due diligence still underway in order to ascertain the financial consequences of the transfer. Next slide, please. The capital programme, as ever with the capital programme, there is limited activity within the first month. Q1, we've just recorded just over 700k's worth of expenditure. The main proportion of the capital programme relates to DPIF, £8.3 million worth of funding related to Digital Priority Investment Fund. What this doesn't incorporate is the radiology information system procurement. We are expecting, once the financial business case has been approved, an additional funding stream to support not only the implementation of the system, but also the program costs in readiness for implementation. Next slide, please. In terms of risks and opportunities identified, the general digital inflation, which is has been articulated within the risk register, which outlines price changes as a consequence of either supply, price or service model changes, and indeed inflation. There's also the risk around the energy prices and any fluctuation over the next few months. There is risks in terms of the under-delivery of the saving schemes, particularly in terms of the recent saving schemes that have been added to the financial plan. As previously mentioned, the disputed SLAs, at the time of writing, the amount of unsigned SLAs identified totaled 4.9 million. That's considerably decreased and now stands at 1.3 million. And the last risk identified is in respect of some of the late work really that was required in order to reprofile some of the capital spend regarding risk and the timings in it to enable Welsh Government to make a decision and health boards also to go through their governance process. That particular risk has been mitigated. The reprofiling of capital has now taken place, and that's been factored into the requirements from the Welsh Government perspective. The last item I'd like to bring to your attention relates to an outstanding opportunity. It is still progressing. We are liaising with HMRC, particularly regarding some of their latest technical queries. We've responded to their requests. We have asked for a timeline in terms of resolution of this particular issue. The timeline we've been given is by September, so we'll be looking to resolve this issue one way or the other by September. Next slide, please. So I'd like you to note the unaudited end-of-year position, the milestones and the achievements of the statutory performance targets, the status in terms of the financial accounts process, and also the actions that have been taken in order to achieve a balanced position for this financial year and to inform the accountable officer letter to be submitted by Helen.
Thank you very much, Mark. If you could take the slideshow down. Lovely, thank you. Any questions or comments on the finance report? I've got two. There we go. Helen, and then Marion, and then David.
Yeah, so just to add to thank you, Mark, really helpful, lots of detail in there, lots to go through given the time of year that it is. But in terms of the accountable officer letter that we are drafting, we're essentially saying that should all of the SLAs be signed and committed to, then we have made some choices that mean we can recoup the deficit in year. What it doesn't do is address it, the underlying deficit. So we do not have a balanced 3-year IMTP, but we will look to kind of break even this year. We're holding off the sending the letter in until we get confirmation on the last kind of SLA discussion that I've had with the chief exec of the organisation that's outstanding on that. So there may still be, if there is still an issue with that, then that will still be part of our position really going into Welsh Government. So that will be considered in the round, I think, with all of the other organisations, and there'll be next steps and conversations on that, but we will keep you briefed.
Thank you, Helen. Marion.
Thank you, Chair, and thank you, Mark, for a very clear presentation, very helpful. On the recurrent, non-recurrent savings, it was heartening at our last board meeting to see that the balance between recurrent and non-recurrent had shifted so that we had a high percentage of recurrent savings in the plan. But of course, since then, we've had to adjust our savings plans to increase the savings target. And then we've seen that flip and the balance between recurrent and non-recurrent go back to what it was last year. Could you, I wonder, just provide a bit of context and clarity as to why that complete shift has happened?
Yeah, sure, Marion. So effectively, it's a consequence of the requirement, really, in terms of meeting the immediate issue. regarding providing a balanced annual plan, which effectively required us to look at quick turnaround savings plans, which will deliver quite quickly. And the discussion at the executive level was around not only what's within our span of control to deliver, but what's going to have the minimal effect in terms of the IMTP and deliverables in the short term. And those particular schemes which percolated to the top really were more the non-recurrent schemes going forward. On a positive note, as part of the process, we did identify recurrent savings as well. So there was an extra £500,000 worth of recurrent savings derived as part of that process. So as in terms of the bottom line, we have closed the gap slightly. But as Helen said, there is the ongoing deficit which needs to be addressed because of the major proponent of non-recurrent savings.
David.
Thanks, Simon. Thanks, Mark, for the presentation. Very clear. Well done. There were a couple of points I just wanted to clarify. So the digital eye care programme and any cost delta associated with that, you had a note on the DPIF slide. So am I right in assuming that that programme is currently funded through DPIF? And the second point of clarification was the disputed SLAs at 4.9 million. I think you said it's down to 1.3 million now, but I'm just confirming I heard you correctly.
Yeah, second point first. Yes, it is down to 1.3 million. We have one outstanding organisation which we're looking to get over the line before the deadline, and discussions are ongoing. In terms of your first point around eye care, yes, it is funded via DPIF, and as Helen said, we are looking in the round in terms of what is the financial requirement for that service, and once it transitions to DHCW, in ensuring that we have the funding available to deliver it successfully.
Just for clarification, before we move on, Mark, I'm not sure disputed is the correct word to use at the moment in the context of the outstanding SLA, because we haven't reached a conclusion. It may well end up in dispute, but it's not at this stage a disputed, is it? Is that fair,
That's
Mark?
correct, Chair. Yeah.
Rowan, and then Ruth.
Thank you, Mark, and you're doing an excellent job for fulfilling the very big shoes and high heels maybe of Claire. So thank you for that. I'd like to just dig in a little bit into sort of the conversations that we've had with health boards around SLAs, and perhaps Helen can give some colour as well. So there's one pushback on the SLAs, which is just, you know, those organisations' specific challenges with their budgets and their commitments. The other perhaps is more pushback on, you know, wanting to see certain things in our services that we don't yet offer, or you know, wanting to see investment, IT investment that they've got go into their organisation. Can you give me some flavour on where those objections are and what's been sort of top of mind for our healthcare partners in the SLA discussions?
Happy to, Rowan. There's a couple of threads to that. The first is a practical thread, really. It's around the governance and decision making, and where those decisions are held and how they're communicated, and really in terms of the discussions and getting over the line with some of these SLAs. There's been a lot of back work, I'd say, in terms of establishing the decisions and how they've been made, and the governance processes in order to get that signed off. The second thing is establishing value and impact. So particularly in terms of our new services that we're offering, it's to provide visibility. Particularly, you may be talking to somebody who's not directly involved in those initiatives. So what we've done is be quite clear this is what you're getting for your money, which is already always a good start. And conversely, the impact if it's not funded, and what that does is provide a good visualization to progress those discussions, and we have found it extremely useful in quite a few cases. There is the overarching issue, as I sort of set out initially, regarding the position which all organisations find themselves in and the tough choices they have to make, and the fact that every penny has to be scrutinised, and that's being played out in the SLA discussions as well.
Thank you, Mark. Ruth, and then Helen. We've got to close then.
Did Helen want to respond to that SLA question first, Simon?
Yeah,
Thanks, Ruth.
Not a great deal to add, other thoughts, but other than Mark.
Well, yeah, just the I think in terms of the challenge that the challenges of getting agreements, the process, the industry involved actually for little value add, I would say, in terms of the discussions we're having on the SLA. So I think there's been some significant increases in the SLA charges that we have put through to local organisations this year, because there's quite a lot that's come online. You've got the Microsoft deal, there are a number of things that are coming into service this year. There are a number of, the indexation that we've had on some of our, key components. And it's tricky, in fairness to the local organisations, and the financial. It would be tricky if we weren't in the current financial backdrop. But the fact that the things are so challenging is where some of those challenges have come from. So I think we've had a lot of feedback that's kind of commended the team. So Mark and our service management team and the wider team who are having the discussions on the transparency that we've gone through to, we've really been able to fully itemise every one of the charges. But it is a real challenge, and the conversations that we're having is what is the value add in terms of having those SLA discussions and the challenges we've got around that. But there is also, I think, a really good challenge back to us as part of that process around the value proposition. And I know, we talked a fair bit about that today, and we've got to be really clear about some of that value proposition. I also think that part of this is the conversations we're having with Welsh Government around the sustainable financial position and our ability to scale and develop and grow to meet the needs that we need to discharge our statutory functions. So I'm not sure that's a clear line at the minute. So I think that there is, that there's a fair bit of work in this SLA that is not really adding a lot of value to either any of our organisations.
But it is surfacing the issue of funding, and probably there is value in that.
Yeah.
Thanks, Mark, for that. I think it probably follows on from the funding question, and I just wanted to unpick the run rate a bit more. I seem to remember in previous years that our run rate has not been so smooth throughout the year, and we've often been sat there thinking, oh my God, are we going to spend all this money in March? And we have done, but actually I just wonder if you could unpick our run rate this year a bit more in terms of where that spend is going to be falling, and is this indicative of decisions we've had to make to try to smooth things out to balance our IMTP, or is it just coincidental that actually that's where the DPIF funding is all falling over the next year?
Yeah, thanks, Ruth, and that's reflective of a conscious exercise really to get underneath the bonnet of the DPIF spend and to make it less volatile, and work with the programme directors, particularly around the activity. What we were finding is there was the planned activity was being planned in particular staccato type stages, and what we're looking to do this financial year is, as you say, provide a smoother profile which is more reflective of what's been delivered and the activity that's taking place as and when it takes place. There will be, as we progress throughout the year, no doubt, and knowing what I know of the history of DPIF, possible reviews and changes to how they deliver their plans. So they may look to use more of third-party resources rather than actually recruit staff, or vice versa. So no doubt there will be some fluctuation throughout the year, but in terms of the initial plans, this is very much where they land. There will be some uptick in terms of the core run rates, and that's as a consequence of timing of licensing and things of that nature. One of the major areas in terms of focus, control, and forecasting is as in previous years, the staffing and the vacancies, and making sure that any change in assumptions is reflected in future forecasts.
Thank you, Mark, and once again, thank you for the presentation, which is very clear and very thorough. And we've been asked to receive that report, which I'm sure people are happy to do. Thank you very much, Mark. If I move us on now, because we are running rather late. To go through the committee reports, the highlight reports, and the first one, 6.5, the Audit and Assurance Committee report. And Alistair stepped into the chair. I seem to recall you weren't well, were you, Marion? I think you had COVID, didn't you, during that meeting? So, Alistair, is there anything you'd particularly like to draw to our attention from the highlight report of the Audit Committee?
Simon, I'll keep it short, just pick out 2 or 3 bullets, if I may. But we looked at the Welsh language compliance and improvement framework. There was an issue there that had been identified within the NHS app login, and a meeting had taken place with the Welsh Language Commissioner's Office to discuss an exemption from this part of the Welsh language scheme for 2 years, and final approval is awaited. We noted that. Finance update, well, we've just had another one, and it was good to get the year end. An outlook for 23-24, the audit of financial statements was on target to be delivered ahead of schedule, and members noted the financial context, as we do in these meetings, and the inflationary and other pressures, and it was considered in the context of the accountable officer's letter. Just picking out the internal audit, annual audit plan 23-24, the committee received that for approval and assurance, and that internal audit had capacity within the team to carry out the 23-24 work, and if necessary to vary it, which was also an important part of the capacity. Audit Wales outline audit plan 23-24, the committee received the Audit Wales outline audit plan for approval and assurance. And just another couple of quick ones, the duty of quality and candour and implementation plan, the committee received a presentation outlining the implications of the Act for DHCW, and we're pleased to note the approach being taken to ensure the whole organisation was part of the process, which is no mean feat and big challenge. And finally, decarbonisation, the estates and compliance report, the committee received an update, and we discussed if those working from home were encouraged to also make low carbon choices at home, as that seems a more permanent part of our working landscape. And that's it, Simon.
Thank you very much, Alistair. Anyone got any comments or questions? No, we ask to note the contents of that report. Moving then on to the Digital Governance and Safety Committee highlight report, and ask Rowan if there's anything particular she'd like to draw to our attention from that report.
Thank you, Simon. Just very briefly, firstly, to note that I had 2 guests at the committee, Alistair and Helen, attended our last committee, and thank you very much, both of you, for your support and interest. As usual, we discussed both the public and the private risks that we've talked about in this board meeting, and received a number of assurance reports. There are a couple of points I would like to alert the board to. So firstly, I think just reflecting on a fantastic piece of work that was presented in the Instant Review and Organisational Learning report led by Keith Reeves, really evidencing that we are living our values of being a learning organisation. So that was delightful to see, and we had a really good conversation about that. And I learned something about the Yorkshire Contributory Factors Framework. So that was very enjoyable, useful, and high quality piece of work. And we also had a good discussion about WASPI, this is the Wales Accord on sharing of personal information, and the discussions ongoing with respect to moving potentially through to a full code of conduct. And again, very much proving and demonstrating the organisation's leadership in the area of information governance. So that was great to see. then the last point really, which comes out of the private part of DG&S, where we discuss risks related to matters that probably are not well served by public discussion. But we always talk about cyber and it being everyone's job from the bottom to the top of the organization. And we saw some really good evidence that the whole of the organization is very engaged with that. And so I'd just like to record my thanks to everyone in DHCW for doing their bit and urge them to keep up their high level of awareness. I'm just going to give one example from my private work, because I think it just feeds into how sophisticated the phishing attacks have become. We had a very credible phishing scam at the company that I founded this week, where employees received a note purporting to come from the CEO, notifying that they'd had a pay award. And if they just clicked here to receive the information on the pay award, and it was actually a phishing scam. And I think we all reflect that would be a very difficult email not to engage with if you received it, particularly in the current climate. I didn't get one, so I was a little miffed that I didn't get one, but there you go. The scammers didn't think I was worth a pay increase. Thank you very much, Simon, and that concludes my update.
Anyone, any questions or comments? No, thank you very much. We receive and note the content of that report. And then moving on to the IM Digital Network highlight report. David.
Yeah, thanks, Simon. 2 points I want to make really. First was we had a briefing on the Welsh Community Care Information System, some challenging pushback from some of our colleagues on the health boards, the independent members there. And the ensuing conversation, it transpired that the supplier had lost a couple of development cycles due to a cyber incident, which was completely oblivious to our healthcare colleagues. So that put a little bit of context around some of the recent delays. And the second point I wanted to raise was we've been in operation for just over 12 months. We did a bit of a review on what's working well and what we might do in the future. And the feedback was very positive in terms of the value of the network, particularly to the health board colleagues, and a few good ideas on things that we can improve going forward.
Thank you, David. And I attended part of that meeting because of the, as you mentioned there, the evaluation, which is going to the next chair's peer network, and the noise the smooth music I'm getting is very supportive of the continuation of the network. But there is one thing I really must do, because you, as was always the plan, you've stepped down from the chair of the network now, and it's been taken over by Maynard Davis, who's the independent member for Howell Bar. And I think it would be right that the board record its appreciation for all the work and effort you've put into making the network work over the first year. So thank you very much for all your work and efforts and that you've put into getting the network operating really well, David. Thank you very much.
Simon?
And we're obviously asked to note the contents of that report, which I'm sure we're prepared to do, happy to do. And then moving on to the last one, which is the Local Partnership Forum highlight report. And I'm hoping that you were in the chair for this one, Helen, because obviously Andrew's given his apologies. So over to you, Helen.
Yes, it was me. I was in the chair. As ever, a great conversation, and thank you to the colleagues who came to provide updates to the forum. We discussed strategic workforce plans and some of the issues and current positions that were in around the ongoing pay discussions, although things will have moved on this week, as colleagues will be aware. And we talked about the current estates plan and good news really in terms of the work with shared service, who we are now. We've got desk space and storage space in the Mamilad site, so we'll, as we kind of close our position in Mamilad, we will have space available through the shared service so staff can remain at that site. But yeah, really good conversation, nothing to escalate to the board.
Thank you very much. And ask the board to ask you note the contents of the report, which I'm sure again we're happy to do. Thank you. I've had no other items of urgent business raised with me, so I shall bring the meeting to a close. The date of the next meeting, we've got two coming up. We've got an extraordinary board meeting on the 13th of July to approve the annual report. And we have then the substantive, next substantive public board meeting on Thursday, the 27th of July. So I'll bring this meeting to a close. As colleagues will know, we have a private board meeting following. Might I suggest that we put down the break a little bit and we start at 2:45. So we'll start the next meeting at 2:45. Thank you all very much. Diolch yn fawr.